Good afternoon, everybody. Hello and welcome. My name is Tamsin Rose and I have the great pleasure to be your moderator this afternoon. And today we are celebrating the final conference of RARE 2030, an intensive two-year programme looking at foresight and different scenarios, how we can improve life for patients and their families with rare diseases in Europe. We'll have a fantastic programme for you this afternoon. I know there are people who've joined from all around the world. We had over 1,000 people register for this event, which is very exciting for us. And this event will give you an opportunity to hear more about the different options and the way forward, and will give you a chance to participate. And I'll tell you a little bit more about how you can engage and the participation focus. But a conference is not just the speakers and the content we provide to you, it's your input and your engagement. And I have a piece of homework for you that I'd like you to do this afternoon as you listen to us. As you hear the different messages and presentations, I'd like you to think about what are your key takeaways. What are the messages you've taken from this and how would you like to see things change between now and 2030? And you can write them in the chat. We'll be monitoring them and using them to build up our conversation this afternoon. And you can also use the social media hashtags, which is at RARE 2030 through Twitter or the hashtag RARE 2030. This afternoon, we're going to be referring to the story of 4 children, and I'll tell you more about them. They were born decades apart, but into very different worlds. Let me introduce you to Isabelle, Luca, Ursula, and Eric. Isabelle was born in France in 2010. It took a decade for her family to get a diagnosis. In the beginning, the symptoms were dismissed. Her family didn't get help, didn't even consider that it could be a rare disease that she was experiencing. Eventually, the family found their way through the internet through searching to a patient group that helped give them information and support and helped them to understand some of the realities of what they were dealing with. But the lack of knowledge and the delay in the diagnosis meant that it was hard for the family. They were unable to keep working while they tried to provide care for their daughter. They didn't have knowledge or treatments or guidelines, things that were only just beginning to be mapped out and identified as important. Let's fast forward to 2020, and let me introduce you to 2 children, Luca and Ursula. Luca was born in Italy. And his family considered that he had good luck in the sense that when he was born, there was newborn screening available. So quite quickly, within 6 months, they'd identified what was the condition that they were living in. Even though there was no treatment for his disease, the symptoms and the pathology was understood, which meant there were standards of care. There were decisions that the family could take together with the caregivers, together with their healthcare providers. They could make decisions about where to live, so that Luca could have the best quality of life, how to manage the care and the different treatment options. But still, it was difficult for the mother to see how she could get back into work to manage all of these. But Luca had hope for the future, that things could be and would be better. Ursula was born in the same year as Luca, but Ursula was born in Poland, which doesn't have the same newborn screening program. So it took almost 4 years for Ursula to get a diagnosis. 4 years when her family were lost trying to understand the situation. And in those 4 years, there were missed opportunities for therapies and treatment options. There were missed opportunities for early interventions. And it meant that she was not able to participate in a clinical trial the way that Luca was, because there wasn't the access for it. Now let's look into a crystal ball. I know that's a dangerous thing to do in the time of COVID when it's hard to predict from one month to the next how things will be. But looking forward towards 2030, how do we hope things will be? Well, in 2030, a child called Eric is born in the Czech Republic. And alongside everyone else born that year, there was an automatic diagnostic very quickly because there was newborn screening. Regardless of where you're born in 2030 across Europe, you and your family would benefit from the same level of care. There was complete data integration, so the information flowed and the new technologies. There was access to the best treatment and care no matter what country it was. In fact, Eric may be able to benefit from gene therapy in Sweden, fully reimbursed by the home system in the Czech Republic. His value in society is recognized and acknowledged. His family is given special support. He has a fantastic educational opportunity in school and is able to live a full life. His family has adequate psychological support. And despite the complexities of managing some of the conditions, both his parents have managed to find a way of balancing that with work because of the range of health and welfare support. So what a difference between the story of Isabel, born in 2010, between Luca and Ursula in 2020, and what we hope for a child like Eric in 2030. And here in the beginning of 2021, we're halfway there. We've already bridged the gap between the isolation experienced by Isabel's family, and we're on the road towards the equity that we hope that Eric's family will experience. But there's a lot of work to be done that still needs to happen. Things that the RARE 2030 project identified through scenarios, what needs to happen and how. And we'll hear later about the European policy framework that they're proposing to put in place to make it happen. Now, at this point, I'd like to introduce the interactive elements of the way that we're going to work. You should be seeing on the screen in a moment, and there you can see it. There's a code. You need to go to something called SparkUp, and there you'll see the link on the screen. So you go to that address and you enter the code TSKCQ. Or you can hold up your smartphone and scan the image on the screen. When we get there, we're going to ask you a very simple question. We'd like you to answer with one word. How are you feeling today? I think in 2021, you can't take for granted how people are feeling in an early sunny afternoon in February. So we're asking you, how are you feeling? And of course, we'll see in real time a word cloud to see how people are feeling. We're starting to get some messages and people are inspired, excited, optimistic. That's a really good sign that we hope that we'll be getting some useful information for you, that people feel mobilized and ready to implement some of the ideas that will be coming through in our program. So keep sharing with us how you're feeling. People are feeling curious, ready for discussion and for change. That's fantastic. Keep putting in all your messages. Hopeful, interested. Yes, we're all hopeful and curious about what we can put in place so that by 2030, the stories of the children are very different. And that when Eric is born in 2030, everything is there in place. So no matter which country he's in, what context his family is in, they have access to the highest quality of what Europe has to offer. We have people feeling determined, positive, emotional, busy, tired, fatigued. I think that's probably also normal. We're living in very stressful, unknown times. But hopefully this session this afternoon will give you inspiration and help you feel empowered. And we've put in place many mechanisms for you to network. Even after we finish the formal part of the event today at 6:30, we're going to leave the chat open and we encourage you to stay for a virtual drink and a networking. We want to help create the kinds of connections that will allow people to build the change for the future. So the screen is changing in front of my eyes, lots of new inputs coming in, people feeling collaborative, blessed, determined, sad, empowered, curious, excited, ambitious, enthusiastic and supportive. So lots of big emotions out there. We know hundreds of you are connecting from across Europe and across the world. We very much hope that if I ask you this question again at the end, that you will have felt fulfilled and empowered, and there'll be lots more of this really strong, positive energy. And this is the end of 2 years of really hard work, and I'm sure you'll be excited to hear some of it as we go forward. But thank you very much for everything that you're sharing so far. It gives us a sense of how everyone is feeling, and it's an opportunity for us here in the studio. I'm broadcasting from in Brussels to connect with you, the audience, wherever you are. And that's such a hard thing to do in a world we're connected only by screens and the internet. So thank you for sharing all of your ideas and how you're feeling. Just to make sure everyone's really got how we're going to do the interaction, we're going to ask you another question. So I'm just going to close this first poll where we were asking you how you were feeling, and we'll keep a snapshot of that and we'll share it afterwards on the 2030 RARE website page so you can see how people felt at the beginning of this. And now I'm going to ask you another question, and it might be a bit of a surprising question. But I can tell you that when I do a lot of these conferences or Zooms, I'm not usually in a studio, I'm at home. And people at home, they're often relaxing. So the question we're going to be asking you, are you wearing shoes right now? Sounds like a strange question, but I can tell you at home, I don't wear shoes. We're not going to embarrass people by asking if you're wearing pajamas, because I know that's a thing when people participate, but are you wearing shoes? Just to get a sense of everyone's physical reality around there. And I can see that slightly more of you are not wearing shoes than are wearing shoes. And that's perhaps not a surprise, because many of you will be connecting from your homes, because very few of us go out to our offices anymore. So I'm going to leave that poll open for another 5 seconds, but I can tell you 2/3 of you are not wearing shoes right now, and 1/3 of you are. So if you just wanted to know, the first image gave us how people were feeling across the audience, and now we know that however they're feeling, 2/3 of them are not wearing shoes. All right, let's close that poll. It was just a fun opportunity to just get some interaction going. We'll be using this tool later to ask you questions, and you'll be rating your responses according to stars or numbers later. So we've practiced that, and thank you for participating. And of course, this event is organised by Eurodis as the lead of the Rare 2030 project, but it is co-hosted with our friends from the European Parliament, who've been strong champions and supporters of the rare disease community for a number of years. And of course, if this wasn't the time of COVID, we'd actually be meeting in one of the rooms of the European Parliament. There's only one big benefit of going virtual, which is we can accommodate more people in our virtual space than we would have done within the European Parliament. I can tell you we would have had a limit of 350 people in a room in the Parliament, and we were able to have registrations of over 1,000 today. So it allows us to reach out to more. But let me please hand over to 2 MEPs who've been significant champions and friends on rare diseases over the years. That's Frédérique Ries and Cristian-Silviu Buşoi. Mrs. Ries, hello and welcome. Let me hand the floor to you.
Hello, Tasmin. Do you hear me? Do you see me? Because I can't see you for the moment.
Yes, we hear you, we see you.
Perfect. It's such a pleasure to be with you all again. And to answer your first questions, I am wearing shoes. And my keywords for today would be inspired, of course. I have been inspired by all of you since so many years. And determined, I would say. That was one for me. It's a pleasure to see that we have more than 1,000 registration. It's heartwarming, I think, in these difficult times of pandemics. Now, coming back to our history together, rare disease and the European Parliament have a long history together. For example, for me, starting in '99, as far as that, because I started on the orphan drugs regulation. I very vividly remember also the very first Rare Disease European Day. That was in 2008, and I was with Turkel at the time. Hello, Turkel. I remember vividly at the time one of the many patients we have met. Her name was Leslie Green. She was the mother of a patient, and she was like all the others, so very inspirational to all of us. So this leads a little bit of history to 2016, when we started actually working on the present Foresight Study with Eurodis, the usual suspect. We didn't know at the time that a worldwide pandemic would force us this year to finally rethink the whole European Health Union. But we knew one thing, we knew Europe could do more to fight rare diseases. We knew also it was the right level of action to improve patients' lives. This indeed was the rationale, I would say, behind Rare 2030, and why we decided at the time to propose it as a pilot project of the European Parliament. Getting it voted was an intense work of internal lobbying. We did it with the help of Eurodis and the European Commission. I must thank them. This is on the why, I would say, and the how we got here today. Now, today, 4 years down the road, Rare 2030 could not be more relevant, I would say. A special report, I don't know if you've mentioned that already, but there was a special report of the European Court of Auditors that concluded 2 years ago that it was time to update the European strategy on rare diseases. The pandemic has also demonstrated how investing in the fight against rare diseases is not only a moral duty to care for the most vulnerable, but also beneficial to all Europeans. And indeed, the COVID-19 clinical management support system launched by the Commission last month of March to respond to the pandemic is in fact directly based on one of our experience of the European reference networks. In that sense, the policy recommendations, which will be detailed in a few minutes, I guess, are more than just foundations for rare disease policies. They are guidance to the innovative, tailored, and collaborative health systems of tomorrow, the whole systems. It is now up to us to keep these recommendations alive, each at our own level. And this is what I wanted to emphasize today. At the Parliament level, for example, I want to assure you, but you know that we will do, we do, and we will do everything we can to support your message. In fact, we already have started incorporating all your suggestions in our work. In July, we took the opportunity of a resolution on the post-COVID health strategy to call for your European action plan for rare diseases. I'm also very happy to see the global support that we receive from the European Council, and in particular from the upcoming Council presidencies. Their efforts to put the priority on rare diseases will be essential to launch a new wave on now much needed national plans. So this Union Sacrée is what we demanded. Union Sacrée, I'm talking French here. Is what we demanded almost 15 years ago. I mean, patients, Parliament, Commission, Council, together to make rare disease a priority. I really am excited and determined, as I said, starting to see what this meeting of today and the next year will bring. I wish all of you a very happy 2021 Rare Disease Day, and I thank you for your attention, and I'm listening to all of you.
Thank you very much, Frédérique. And as you say, the European Parliament was instrumental in launching the Rare 2030 project by specifically dedicating the funds to it. Let me turn to your colleague in the European Parliament, Cristian. Cristian, what would you like to share?
Thank you very much. I will be very brief because I am supposed now to start also Industry, Research and Energy Committee that I'm chairing. I would like just to say that promoting rare diseases is one of the most important stated objectives of EURORDIS that I'm proudly supporting and promoting since years already. And I'm very happy to be here accompanying my fellow colleague, Frédérique, to the final conference for Rare 2030 pilot project that we sponsored in the European Parliament, and yet another milestone to improving the lives of people suffering from rare diseases. Rare 2030 is a project that applies foresight to the future of rare disease policy in Europe, as it was mentioned, but also a roadmap with clear recommendations to achieve better true changes in policies and strategies. Tremendous progress has been made for people in Europe living with rare disease via policies and legislation, but they remain vulnerable and still face too many unmet needs like late diagnosis and equal access to expertise and treatment. Moreover, in the current pandemic, in particular, the patients suffering from rare conditions were most vulnerable. European reference networks under the third health program was a success. Therefore, under the EU4 health program, the EU4 health that I was the rapporteur for European Parliament, we called for an up-to-date rare disease strategy and for continuing the financing of the ARN, reducing bureaucracy, direct funding, and at the same time reinforcing and expanding the role of European reference networks with more expertise. It will be of paramount importance that the Rare 2030 recommendations will be synergic with the newly adopted MFF instruments in the field of health, including pharma, in the field of data and emerging technologies, and research and innovation. Thank you so much. A lot of success.
Thank you very much, Cristian and Frédérique, two members of the European Parliament. We appreciate very much your support, and thank you for taking time out of your schedule to be with us today. Your support is very much appreciated. And you mentioned that the European Commission has a key role to play, and we now have a video message to share from the European Commissioner with responsibility for health, Stella Kyriakades.
Ladies and gentlemen, COVID-19 has upended our lives in so many ways. Like any virus, it has targeted the most vulnerable among us. Rare disease patients will know this better than most, especially those that cannot rely on the protection of the immune system. So I'm delighted to be part of today's event, because although this initiative began well before the pandemic, the Rare 2030 project is more relevant than ever. In the midst of the storm, your project stayed on course and, true to its inclusive nature, gathered patient and expert input from across Europe. Today's recommendations are the result of a major effort to inform and support rare disease policy. I had the opportunity to address the rare disease community already last year. I assured you then, as I do now, that rare disease policy will remain an important focus for the Commission, and that patient voices will continue to inform our approach. Both innovation and patient participation have been at the heart of the EU effort for over 20 years. However, it is essential that these achievements are consolidated, and we will look to make concrete, tangible improvements to the lives of rare disease patients and to their families. That is why we will revise the orphan and pediatric legislation as part of the new EU pharmaceutical strategy. The objective is clear: to foster research and development of medicines for rare diseases, contributing to better availability and more timely access to those medicines for patients. I also want to mention the European reference networks, which I believe offer great potential for rare disease patients. These networks connect specialized centers across the EU to improve diagnosis and care for patients with rare and complex diseases. They are based on the principle that knowledge travels, not the patient, and they are providing answers and hope to patients and their families where before there was none. Finally, the new EU for Health programme aims to maximize this potential and will include important actions to strengthen the ERN system. Ladies and gentlemen, COVID-19 has shaken us all, but I believe it has also brought us closer together. I am convinced that we can come out of this pandemic with stronger, with more resilient and more accessible health systems, which protect and provide for rare disease patients and which address inequalities and unmet needs. Your voice, your perspective, your insight are central to this effort. So let me conclude by congratulating you once again for this important work, and I look forward to working closely with you to build a better future for all people living with rare diseases in Europe. Thank you.
Thank you very much, Commissioner, for your strong words of support. And as you mentioned, the Rare 2030 project began before the COVID pandemic and has carried on right the way through it. And in a few seconds, we're going to watch a video about it. But before they do, I just want to recognise we have people joining us from all across Europe and from the world. So we have people online from Belgium, from Germany, from Greece, Poland, Italy and Finland. So the north, south, east and west of Europe. But beyond that, we have Japan, we have Russia and Tunisia also participating. So we know that there's a strong interest that what Europe can deliver acts as a beacon of hope for countries around the world about what might be possible for the lives of rare disease patients and their families. So let's now find out a little bit more about what's been happening for the last 2 years, the Rare 2030 project. Here it is, the video that explains what's been going on.
Rare diseases were nearly invisible in our health and social care systems in previous decades. Today, they are recognized as a public health and human rights priority. With this recognition have come investments, transformative treatments, new knowledge, and, more importantly, hope. Yet for the 30 million people in Europe living with a rare disease, huge challenges remain. What's your role in this? Europe's leaders in the field have embarked upon a journey, the journey of the Rare 2030 Foresight Study, to prepare a better future for people living with a rare disease. Achieving this success is a question of design, and the Rare 2030 Foresight Study has been designed to be iterative, participatory, and inclusive. It calls upon Europe's most dedicated doctors, companies, researchers, young citizens, advocates, patients, payers, and policymakers. Together, they comprise expert panels of over 250 key thought leaders and thousands of people living with a rare disease. These bright minds follow 4 steps of reflection. First, they consider the remaining challenges. Next, they scan the horizon for predictable trends, but also unexpected impactful events, such as the COVID-19 pandemic, which has rocked the vulnerable rare disease community and the rest of the world. By combining different progressions of these trends, 4 possible future scenarios of rare disease policy emerge. Which one we follow is down to you. The message from the rare diseases community is loud and clear. To design a future that allows all people to live to their fullest potential, we need our policies to be defined by societal responsibility, equity, and collaboration. After 2 years of consultation and dialogue, we are coming to the end of this journey, but a new one is about to begin. The Rare 2030 community has identified the need for a new European policy framework for rare diseases, which recognises new technological opportunities, modern values, and the current healthcare policy context. A new policy framework that leaves no European citizen behind. For a better future for people with rare diseases, this framework must 1. Increase the European Union's investment in areas of health and social welfare, especially for Europe's most vulnerable citizens, no matter where they live. 2. Be led on the ground by adequate national rare disease strategies and investments. 3. Be driven by a holistic view of needs, including the curative, but also the palliative, rehabilitative, and preventative. 4. Foster a continuum of data collection that is transparently shared across borders and sectors. 5. Prioritize investments in neglected areas of rare disease research through multi-stakeholder collaborations. 6. Innovate, with the right harmonized regulatory frameworks and incentives, taking the full life cycle of new technologies and the patient experience into greater consideration. 7. Bring together public and private partnerships to improve rare disease diagnosis, care, and treatment. 8. Clearly measure the progress that we want to make. But how exactly do we achieve all this by the year 2030? How can we ensure people living with rare diseases are entitled to the same rights, social inclusion, and quality of care as any citizen? The Rare 2030 recommendations are the first step in providing Europe's institutions with clear instructions on how to make this happen in the decades to come. But whether this is implemented is not just in the hands of the policymakers. We need a collective voice asking the right questions of our social, health, and research systems. Why does diagnosis still take so long? Why can't we access this treatment in our country? Why are so many people living with a rare disease unnecessarily left behind? A collective voice from every corner of Europe, from every disease group and every discipline, using this roadmap so that the health and well-being of 30 million people with rare diseases in Europe is not left to luck or chance. For every person living with a rare disease in Europe, let's make our request for a new policy framework heard.
So there you have some of the key principles and the process in the Rare 2030 project. And we'll have a chance to hear a little bit more from some of the key researchers a little bit later as they tell us what they've been doing and how they developed some of these recommendations. But I think a few points that are worth mentioning now, which is that it was a process that was inclusive, that engaged people from different countries, their families and patients to understand what was important and what would make a difference, a positive impact in their lives. And the policy framework started from that, from the real life experience of rare disease patients, their carers and their families. And of course, what we're looking for is change at European level and at national level. And in the chat, please feel free to share your comments, your feedback, what occurs to you as you've seen those messages about the Rare 2030 project. And we'll try to bring in some of your chat comments as we go forward. The French government will be holding the EU presidency next year, and it will be their opportunity to take forward some of these recommendations and translate them into actions. So now let's hear a message from Olivier Véran, the French Minister for Solidarity and Health. And he has this message to share with us.
Madame la Commissaire, Mesdames et Messieurs les ministres, Mesdames et Messieurs les députés, Mesdames et Messieurs les professionnels de santé et de recherche, Mesdames, Messieurs, chers tous. Le thème qui nous réunit aujourd'hui est de ceux qui demandent de la détermination et de la force collective. Je me réjouis donc d'être parmi vous et je salue l'initiative d'Eurordis qui conforte ma conviction que l'Europe de la santé n'est plus simplement un beau projet un peu abstrait, mais bel et bien une réalité qui chaque jour devient plus tangible. Et une idée abstraite ne devient pas une réalité concrète sans des hommes et des femmes qui se remontent les manches et qui travaillent ensemble. Hommage soit donc rendu à vos travaux, parce qu'ils sont d'autant plus utiles pour faire avancer la lutte contre les maladies rares en Europe. C'est essentiel parce que derrière chaque maladie rare, il y a un patient, et le plus souvent toute une famille, confrontés à des impasses diagnostiques, thérapeutiques, qui sont toujours synonymes d'impuissance et de détresse. Qui dit maladie rare ne dit pas rareté du phénomène. En France, près de 3 millions de personnes sont atteintes d'une maladie rare, ce qui est considérable et doit conduire chacun à redoubler d'efforts et d'ambition. C'est tout le sens d'une politique nationale dédiée qui surmonte les obstacles liés à une information limitée sur la maladie et permet de réduire l'errance de diagnostic, de favoriser les conditions pour l'accès à des thérapies efficaces et d'organiser les parcours de soins du malade. Depuis près de 20 ans, tant à l'échelle nationale qu'à l'échelle européenne et internationale, la France s'est engagée dans ce combat avec un plan de santé consacré aux maladies rares adopté en 2005. Avec un réseau de près de 400 centres de référence, coordonnés par 23 filières de santé maladies rares mises en place en 2014, la France a fait le choix d'un réseau de soins permettant sur chaque territoire de trouver des informations pertinentes et des solutions thérapeutiques. Lors de la précédente présidence française du Conseil de l'Union européenne, en 2008, la France a eu un rôle très actif en faveur de l'adoption d'un cadre politique européen pour les maladies rares. 2 textes européens ont ainsi été adoptés, encourageant l'ensemble des États membres à élaborer des plans nationaux. En 2011, la directive européenne sur les soins transfrontaliers a permis la mise en place des conditions de création des réseaux européens de référence. Cette directive n'était pas un document technique, c'était une feuille de route pratique, permettant à chaque pays membre de l'Union européenne d'améliorer les parcours de diagnostic et de soins par le partage encadré des données de santé et par une formation plus solide des professionnels de santé sur les maladies rares. L'objectif que nous poursuivons tous, c'est d'améliorer dans chaque pays membre de l'Union européenne les parcours de diagnostic et de soins par l'élaboration de recommandations de bonnes pratiques. C'est aussi de renforcer le partage encadré des données de santé et permettre un développement de la formation aux maladies rares pour les professionnels de santé. Ces efforts ne sont pas inutiles, bien au contraire. Ils conduisent à des résultats très concrets dans la vie des citoyens européens atteints de maladies rares. Ils permettent notamment de rompre l'isolement des personnes malades, avec une meilleure orientation vers les centres de référence maladies rares, et ils garantissent une articulation intelligente des actions de soins et de recherche par les 23 filières de santé maladies rares. Je me suis promis de ne pas être chauvin, mais vous ne m'en voudrez pas de rappeler que la France est au centre de la coordination de projets européens puisqu'elle héberge la plateforme Maladies Rares qui rassemble les associations de patients, Eurordis, l'Alliance Maladies Rares, l'AFM Téléthon, ainsi que la plateforme d'écoute Maladies Rares Infoservice, la Fondation Maladies Rares et Orphanet. Orphanet constitue justement depuis 1997 la base de données indispensable d'informations et de connaissances dans le champ des maladies rares. L'Union européenne finance actuellement un projet européen sur les maladies rares, pour lequel la France est depuis 2019 pilote au travers de l'INSERM. Ce projet vise à définir les conditions d'un cercle vertueux entre la recherche, le soin, le diagnostic et l'innovation thérapeutique. Voilà l'Europe de la santé en acte. Une Europe qui est, je crois, au cœur des attentes de nos concitoyens, bien loin des caricatures technocratiques, bien loin de l'image d'Épinal un peu vieillie sur les quotas laitiers et le calibre des concombres. C'est notre avenir commun, et en parlant d'avenir, permettez-moi de dresser maintenant quelques perspectives pour les années qui viennent. À l'aune de la présidence française du Conseil de l'Union européenne en 2022 et de la dernière année du 3e plan national maladies rares, je souhaite réaffirmer l'engagement sans faille de la France. Tous les ministres européens de la santé sont, et moi le premier, très occupés, c'est le moins que l'on puisse dire, par l'épidémie, mais nous ne devons pas perdre de vue les autres enjeux de santé publique et les maladies rares en font bien entendu partie. À partir de janvier 2022, la présidence française de l'UE fera de la lutte contre les maladies rares une priorité, avec un renforcement des réseaux européens de référence en concertation avec l'ensemble des acteurs européens et la révision du règlement européen sur les médicaments orphelins. Voilà l'horizon que je fixe. Je sais que beaucoup reste à faire, que les incantations ne suffiront pas à relever cet immense défi. Le projet RARE 2030, initié par le Parlement européen, financé par la Commission européenne, a souligné toute l'importance de la solidarité nationale pour soutenir le quotidien des personnes malades et de leurs aidants. À chaque élection européenne, il est de bon ton de parler d'Europe sociale, d'harmonisation des systèmes de protection sociale. Je suis un militant convaincu de la sécurité sociale. Et je crois qu'il y a dans ce domaine un véritable projet de société européenne et un formidable moyen de réenchanter le rêve européen. Une Europe unie, une Europe soudée, c'est une Europe qui sait réduire l'impact des maladies rares pour les personnes touchées et pour leurs aidants. C'est une Europe qui s'appuie sur le développement des innovations en matière de diagnostic. C'est une Europe qui propose à chacun des parcours de soins de qualité et coordonnés. Le dire, c'est bien. Le faire, c'est mieux. Ces derniers mois, face à une menace inédite et extrêmement brutale, l'Europe a su faire front en conjuguant les efforts de tous les pays membres. Demain, nous saurons garder cet esprit collectif et nous saurons nous donner les moyens de nos ambitions médicales et scientifiques pour faire avancer la recherche et les soins contre les maladies rares. Je vous remercie.
Thank you, Minister. And it's very clear this strong commitment of France with its key position at the research and the participation around the area of rare diseases. But of course, you mentioned in the video how the work that's being done on the epidemic now is very much based on the skills that were developed through the reference networks which address rare diseases. So that's a really clear, concrete example how an investment in supporting the infrastructure for rare diseases has a huge knock-on benefit for the rest of our health and welfare systems. So even as our health systems are under such strain trying to deal with the COVID pandemic, we recognise that its resilience, its capacity to respond is built on its ability to deal with people in the most extreme and hardest of circumstances. And using the important principle of healthcare, nothing about us without us, it gives me great pleasure to introduce the next speaker, which is Turkel Andersen, the President of Eurodis Rare Diseases in Europe, the Patients Network and the Patient's Voice. Turkel, the floor is yours.
Today we are at the conclusion of 2 years of inspirational effort to lay the foundation for a better future for people living with rare diseases in Europe. To bring together all stakeholders in this Foresight Study would not have been possible without the initiative of the Parliament and its key members that we heard today, Mrs. Frédérique Ries and Mr. Cristian-Silviu, as well as with the support of the EU Commission. We at Eurodis are proud to have been chosen as the lead of this project. The policy recommendations that we will discuss today result from hundreds of hours of consultation and co-production. We thank the hundreds of experts and thousands of people living with a rare disease who have contributed their expertise and experience. When we started, the world and our lives were different. The COVID-19 crisis has had a deep impact on all of us, and not least the rare disease community. Healthcare systems on the brink of collapse have led to delays in diagnosis and treatment with severe consequences for many people living with a rare disease. But the European response to the COVID health emergency also showed our ability to mobilize amazing resources and skill. The development of vaccines in less than a year is a triumph of science. It has, though, gone mostly unnoticed that the design of RNA vaccines owes a lot to innovation in gene editing, techniques that are being developed and refined, e.g. with the aim to find cures for rare diseases, thus vindicating the words of British physician and anatomist William Harvey, who almost 400 years ago insisted on the study of rare diseases to achieve new insights in medicine. He wrote, "Nor is there any better way to advance the proper practice of medicine than by the careful investigation of cases of rarer forms of disease. Today, we as rare disease patients feel as entitled to benefit from the fruits of medical progress as anyone else. We must learn from the coordination, cooperation, and streamlining procedures which have reduced delays in access to treatments and vaccines for COVID-19. Suddenly, smart ways to speed up access could be adopted and implemented in very little time. No doubt about the urgency, but for the rare disease community, the urgency is no different. We just live an everyday emergency, silently but no less painful. We have come a long way since the Council recommendation of 2009 with infrastructures and technologies we could only dream of 12 years ago. But it is imperative to address the remaining unmet needs of the 30 million people living with a rare disease in Europe. The diagnostic journey is often far too long. Only a fraction of rare diseases have treatments, and being included in our societies and economies is an unrealized right for far too many living with a rare disease. The recommendation from the Rare 2030 Foresight Study should therefore be translated into a new policy framework solidly integrated and sustained by the EU and its member states. We must re-incentivize the European strategy for rare diseases with measurable objectives for these unmet needs. We must renew our strategy in order to make equal access to health a priority and a distinct value of Europe. We must coordinate across research, digital, healthcare, and social welfare to harvest the synergies of European collaboration. If we do so, the lessons taken from the COVID-19 crisis, combined with the recommendations of this Foresight Study, will be seen as having provided important guidance for the coming years towards a Europe for health. Thank you.
Thank you very much, Turkel. And you've reminded us that for the patients and their families with a rare disease, it is a silent, everyday emergency that they're dealing with. And all of the capacity to bring people together and focus attention and invest resources and focus in the COVID pandemic shows us what is possible. It shows us what can be achieved, how much progress can be done very quickly when we share data, when we commit our capacities to achieve change. And so I think you've made a good point that what your audience would like to see for the future is that same momentum and collaboration being applied to the broad range of rare diseases that still have no treatment options available to them, a situation that we hope would change. You've also raised an issue that Europe has a role to play, but it's not the only role to play. And I note that we've had a point in the chat that said we've had a message from Norway to say that you need to have strategies and budgets and evaluation mechanisms. And all of that happens at national level. Let's be aware that Europe is a very small proportion of the overall budget and focus that happens in Europe, the majority of which happens at national level, which raises a really interesting question. What is Europe's role? And here to give us more insight is we have a speaker, Nikolaos Melinis, from the European Court of Auditors. And their role in the European project is to understand how we get best impact, best return on investment for scarce public funds. And a few years ago, they looked at what Europe was doing in health and how it was spending its money. And they assessed it to see, are we doing everything we could? Are we using all of our instruments to the best effect? So I'm delighted to introduce Nikolaos Melinis to share some of the findings of the European Court of Auditors and their recommendations about what Europe could do to achieve even more impact. Nikolaos.
Good afternoon, ladies and gentlemen. I would first like to thank the organizers for this conference for the opportunity to briefly present you what we at the European Court of Auditors are doing to support EU health policies. Traditionally, auditors tend to focus on accounts and irregular spending. This is certainly part of our core business. While it is essential to follow the rules, it is even more important to achieve results with European money. Since many years now, we have shifted the focus of our audits to checking the performance of EU policies. We have put the European citizens at the heart of our strategy, selecting audit topics in areas affecting their daily lives. As you know, health policies are largely managed and financed at the national level. The EU complements the actions of the member states. It acts on cross-border issues and in areas where joint actions might bring economies of scale and an improved service. This is in particular the case of the thousands of rare diseases which affect around 30 million people in the European Union. In 2019, we published a report on the implementation of the Cross-Border Healthcare Directive. Our overall conclusion was that the European Union actions in cross-border healthcare were ambitious and enhanced member state collaboration, but that they require better management. The impact on patients will still limited at the time of our audit. We recommended that the Commission provide more support to national contact points responsible for providing information for cross-border patients. EU patients still face challenges in accessing healthcare abroad, and information is sometimes difficult to access, especially regarding rare diseases. Only a minority of potential patients are aware about their rights to seek cross-border health care. Our second recommendation focused on the exchange of data, of health data. We found that there were delays in the deployment of the EU health infrastructure and in the cross-border exchanges of electronic prescriptions and patient summaries. The third recommendation aimed at improving access to cross-border healthcare for rare diseases patients. European reference networks were facing significant challenges to ensure they are financially sustainable and able to operate effectively within and across national healthcare systems. And the European Commission needs to assess the results of its rare disease strategy. The Commission and the Member States are now taking action. Your event also may contribute to triggering progress. We at the European Court of Auditors will continue to independently audit the European health policy and follow up in the coming years on the actions taken to implement our recommendation. Thank you for your attention.
Thank you, Nikolaos. And a very useful message where you talked about how the European Court of Auditors has shifted their perception away from just checking that money is being spent according to budget lines and is starting from the point of view about citizens' lives in Europe and what might make the most impact on them, and therefore how could European policies perform more effectively. And please keep your comments coming in the chat. We're monitoring them. We've had one message that said that one of the reasons that we need to have a new strategy is so that smaller European countries can benefit, so patients living in that area have access to it and the same level of knowledge and support and chances that others do, because many rare disease groups experience difficulties accessing that expertise. Let me now introduce our next speaker, and I'm delighted to introduce Rebecca T. Skarberg, she's living with OI, and she's going to share a sort of personal experience of how some of these recommendations could impact, what difference it would make to the life of someone living with a rare disease. Rebecca, the floor is yours.
Thank you. It has been a great honor to be a part of this very special project. Building tomorrow's roadmap for rare disease is a project close to heart, simply because I myself recognize the many obstacles of rarity just all too well. I remember being in Romania in 2019 at the first workshop, thinking that 2030 seemed to be light years away. We who live with medical conditions feel the change and progress is far too slow on the rare disease field. It seems that many of us are still facing the same obstacles as our forerunners did 30 years back. It's a long road to diagnosis, an exhausting search for information that might not even be out there. Research and treatment options might not exist, or they don't exist in our corner of the world, or even worse, they're just too expensive to access. Enough is enough. We need to change this. Within this 2-year project, we ironically were reminded just how quickly things actually can change. In 2020, our workshops were moved online, and we all know why. Thanks to the recommendations of 2009, we have made some big steps forward. We have national plans in many countries. We are more connected through the huge machinery that the European reference networks are. In some areas, we do have new treatments and a faster diagnosis, and I dare say that our voices are growing stronger in parallel with these breakthroughs. Look at where we're at. But my friends, there's no time to slow down. The clock is ticking. People are waiting for a chance to fulfill their potentials, for a chance for independence. People are still waiting for equal rights to a precise diagnosis and to the newest innovations, to involvement and care on their own terms. Quite simply, an equal right to feel safe at the hands of healthcare. We have to keep on moving because rarity is not a problem to fix or overcome once and for all. Rarity impacts our lives on top of the condition itself. Rarity will therefore always play a key role in how we decide to organize healthcare. Let's keep on working on making the impact of rarity as manageable as possible. The recommendations of 2030 show us that we still need a protecting hand over rare disease when priorities are set, when budgets are debated, and when healthcare becomes a tug of war. If we handle rare diseases disease by disease, we will never reach enough prevalence, documentation, or profit to compete with other just causes. This will not lead us to the preferred scenario of Rare 2030, of a society of social justice. We need to look at the bigger picture, and therefore we need a new policy framework for rare disease at the EU level. The milestones achieved by ERNs prove what great progress we can achieve when we work together. But these infrastructures are not enough. With the suggested new policy framework, we can actually speed up the diagnosis process for many ultra-rare diseases. We can continue to find treatments instead of putting Band-Aids on symptoms. We can share data more efficiently, and we can make research needs-driven. Most importantly, the expertise will have a chance to trickle down into these local services so that we make sure to leave no one behind. We can stop expecting parents to become scientists, doctors, and coordinators on their free time. Having a rare condition should not have to be a full-time job. We have our own lives to live, and we expect our voices to continue to be listened to. In 2030, our healthcare will not be left to chance. Finally, I want to leave you on this positive note. I have high hopes for where the recommendations of Rare 2030 will lead us. The pandemic has shown us that we actually have the ability to work together. We have the infrastructure to develop a vaccine in less than 1 year. And on that note, let's continue fueling the field of rare disease, and let's continue pushing for change and working together on the road to 2030. Thank you.
Thank you very much, Rebecca, for explaining so clearly and concisely how the impact of living with a rare disease when there isn't the supportive network in place, the impact it has on the individual, on their family, how exhausting it can be, and yet what is possible if we get the framework right. And I took your image of a protecting hand for rare diseases, and I think you're right. As the pandemic, hopefully we move to the post-pandemic period, there'll be a rediscussion about changing and updating and transforming our health services. And I think there's an important role to keep that protective hand over the rare disease infrastructure and support that's been done so far, because it was beneficial. It was the starting point for our efforts to deal with COVID-19, as some of our earlier speakers have said. So we need to maintain that protective hand, because who knows what benefits it would have for the system in the future, as well as for the individuals most affected. So thank you very much, Rebecca, for that very clear message. And I just wanted to say that we have about 650 people already online. So we are the equivalent of filling the hemisphere for the plenary of the European Parliament. So we've already gone to double the size of the room we would have had there. So we know we're reaching out to a community that's interested in knowing what's the roadmap to move forward in the next 10 years. So let me pass the floor to Kate Buşoi, who was the lead researcher for the RARE 2030 project. And she's going to introduce a panel who will share how the recommendations were developed and what they hope could happen. Kate, I'm going to pass the floor and the management to you. You're on mute, Kate. Can you unmute yourself? You should be able to see a microphone screen on your own screen. No, we still haven't found the solution. I noticed you have the same backdrop as Turkle. I think that's probably, is that the picture with the plants and the RARE 2030, is that going to be shared with everyone? That's the image of the project. Have we managed to find the unmute for you? Have you found it on your screen? It's on the bottom left-hand side. You should see an image. If you put your finger or your mouse over it, you should see in the bottom left-hand a little microphone icon. And you have to unmute it. Unfortunately, we're not allowed to do it at a distance because otherwise we could take control of your computer, and those kinds of things are not allowed in today's world. Yes, in the bottom left, you should see on your screen it says unmute.
Great, I think that's done it now.
We have you now. Excellent. Thank you, Kate. The floor is yours.
It was sharing the screen, sharing the slides there that took away my button. So that familiar little unmute button had disappeared. So hopefully it's there again and I'm still controlling the screen. So good afternoon, everybody, and welcome again to this important conference. I think we just had a great challenge there from Rebecca. People with rare diseases are still waiting for things to get better for them. And hopefully this is going to be the way forward for things really to change over the next 10 years. I was a research advisor on the RARE 2030 study. I wasn't one of the main researchers, but you're going to hear from several of the main researchers commenting on recommendations specific to their area of expertise as we go through this presentation. So the first recommendation in itself is just a crucial and game-changing one. The RARE 2030 Foresight Study feels that there should be a new policy framework for rare diseases. You may think that's obvious, but actually it's not. It's taken a lot of decision making and a lot of thought to show us that without a new policy framework, it's going to be really hard to work together. And working together is how rare diseases move on. Working together is how we really make a difference for people whose conditions are among the rarer of those in the communities. We can see that the recommendations are comprehensive. We can see that they've taken into account so many different thoughts from so many different areas. We can see that they propose updates, adaptations, and replacements of current strategies, some of which have been hugely successful and others where more input is needed. We have a roadmap. That's an exciting thing to have, a roadmap with deliverables and dates and milestones. We believe, and we've had input from new generation into these recommendations, that these recommendations should be fit for purpose for the coming years, taking into account not only what we've already been able to do, but also all the upcoming new technologies that are coming online now. It's a framework which will only work with the support of member states and European countries. And we really want to show that it can change outcomes and change the way that people with rare diseases are living with their conditions over the coming years. You've come across these frameworks before, these scenarios. It may be if you were part of the ECRD last year. The whole of the RARE 2030 framework programme was thinking about, where should we be going in terms of the kind of health system and the kind of situation which will best support patients with rare diseases. And it was very clear from that input from across the board that rare diseases are a particular area where we need social justice. We need collective accountability. We need patient-led innovation. If we go only on the road for individual responsibility or market-led innovations, then patients with rare diseases are once again going to be left behind. Because without that collective thought and that collective accountability, we are really not going to make that progress. And therefore, investment for social justice is the guiding principle and the guiding scenario within which these recommendations sit. There's a little bit more that you can hear about that now in this short video.
If we prioritize societal responsibility, equity, and the collaborative policy frameworks to achieve them, we will end up in the investments for social justice world, where major investments have been made by governments and are fairly shared across Europe, ensuring health and well-being of all European citizens, and equity for vulnerable populations, including those living with a rare disease. The European Union's increased legislative power in areas of health and social welfare fosters access to care, treatment, education, employment, leisure, psychological support, and reduces the risk of being left behind, no matter where you live in Europe. Healthcare systems are led by an understanding of a holistic view of a patient's needs, including the curative, but also the preventative, rehabilitative, and palliative. This understanding is based on comprehensive health data collection, seamlessly shared across borders in a system also designed to integrate data from consumer and profit-driven companies. Multi-stakeholder initiatives prioritize investments in rare disease research that responds to patient needs. These efforts cover as many diseases as possible. The resulting innovations are regulated and assessed at the European level and with greater transparency, accountability, cost-effectiveness, and consideration for the patient experience. With the right public and private partnerships, the field of rare diseases could play a pioneering role in promoting such a deep, positive change in European health and social policy for all citizens.
So, the recommendations themselves. Now that we understand a little bit more about the framework in which we want these to operate, let's go in a little bit more detail into this whole range of areas that we want to see embodied in healthcare policy across Europe, both at a national and an international collaborative level over the coming years. For each recommendation, there's been a really huge amount of consultation and a whole amount of thought and a whole amount of synthesis of where the best prospects lie. So a specific issue has been taken into account in terms of thinking about the Rare 2030 goal and vision, panel of experts, the Rare Barometer's Voices survey, and very importantly, a young citizen panel have all fed into what the recommendation should be, and crucially, how we get there and how we monitor success. Some of this is in the executive summary, which you have access to through the website, but the whole recommendations document is well worth a read. There's lots of detail in there, lots of fine granular information that you can find. We're now going to go into some of these areas of recommendations in a little bit more detail with the help of the panelists, all of whom have been intimately involved with the way that the Rare 2030 project has been set up, all of whom have been involved in the drafting and finalisation of these recommendations. Many of them will be very well known to you. We have Jan Le Cam, who's the Chief Executive Officer from Eurordis, Anna Rath, the Director of Orphanet, Lucia Monaco, Chief Scientific Officer at Fondazione Telethon, Maurizio Scarpa, who's one of the founder coordinators of the ERN programme and coordinator of Metab ERN, Fanny Laura Mantaglia, Young Citizens Representative, Giovanna Giuffre, Foresight expert at Isinova, who supported the Foresight Study, and Vicky Headley, who worked with me for many years as the Rare Disease Policy Manager and still is leading on the rare disease effort at Newcastle University in the UK. So let's start with recommendation number 1, the meat of the matter in many ways, the recommendation that we need long-term integrated European and national plans and strategies. It's been clear for some years now that technology and other things have moved on so fast that the framework that we had in order to work with rare diseases was becoming outdated. It was also becoming the case that national plans were becoming inconsistent and not regularly updated nor implemented. So the new goal, the new vision for all of this is about aligning all of these efforts, embedding them in a sustainable framework with adequate funding in order to move forward with a cohesive and connected plan for everybody. The recommendation involves setting up a long-term integrated plan, both at the European level and supported nationally, because as we've already heard, the national level is where plans have to be implemented on a day-to-day basis. Who better to hear about this from than Jan Le Cam? So Jan, why do we need a new policy framework and why now?
Thank you, Kate. With this multi-stakeholder pan-European Foresight Study, there is really two key points. One is that in the last 12-15 years, we had real and important progress for people living with rare diseases. But today, there is still high unmet medical needs, and there is still 20 million people affected in the European Union, 30 million in Europe. The second thing we've learned is that we have a lot of new knowledge, new experience, new good practices to implement now, but also huge potential at hand to improve the situation, in fact, to address these unmet needs of persons living with rare diseases. And we can be ambitious. We can aim for public health objective. Job is not done. We're only halfway. And the preferred scenarios which you just presented of investment for social justice has these two axes: the patient needs-led innovation and the solidarity. And that takes us to a strategy based on two strong elements: performance and innovation. Performance in the sense that now we can have objectives like reducing the time to diagnostic and increasing the population to be diagnosed. We can set the ambitious objective of saying that 90% of the people affected by rare disease in Europe by 2030 should be diagnosed within 6 months after the first contact with a health professional. We can set the ambitious goal in terms of survival and quality of life for many of the rare diseases. We can set important, ambitious goals to reduce the social and economic burden on the patients and on the families. Let's say by 30% by 2030. That's possible, and that's very much aligned with the objective of the Sustainable Development Goals. But also, I would say, performance of having the EU as a world leader in terms of pharma, of biotech, of digital technology industry. We're not there yet. But second, the innovation. Innovation is all across. It's innovation in diagnostic, the tools, but also the process, the treatments, not only the products, but also the research and development, and how we provide access to patients. It's innovation in healthcare. It's innovation in digital technology, how we leverage it, and also in artificial intelligence. So performance and innovation. This approach is different than 15 or 10 years ago. Why that? Because 10 years ago, what we did was to develop instrument means, creating centers of expertise, registries, research infrastructures. And what we were measuring were process outcomes. This time, for the next 10 years, we can have qualitative and quantitative public health objectives, really talking about impact on society, impact on the life of people, impact on our economies. And to conclude on that, of why we need a new policy framework, is that these recommendations overall are calling for a holistic approach to the person's needs, 360-degree view, but also a holistic approach between research and care as being integrated between medical and social. And for this, it is powered by digital technology, by data. It requires new capabilities in terms of harmonization, in terms of standard, in terms of interoperability, in terms of human resource and equipment, and that takes us to member states. So we can have progress on this scenario only if the member states are fully on board, fully coordinated between themselves and integrated. And for this, we need a new policy framework.
Thank you, Jan. New policies at the European level need to be supported by work nationally. And we're going to turn to Vicky Headley now to think about how this is going to work out at the national level. What about national plans, Vicky?
Thanks, Katie. So national plans for rare diseases, the momentum around these, unfortunately, despite some really great examples, seems to be somewhat declining in most of our countries. So we know the stats. We did our last data collection at the end of last year, and we know that 25 European member states had adopted a plan or strategy at one time or another, in line with what the Council recommendation asked them to do over a decade ago. That's great. But the what happens after, what comes next, is actually a cause for concern. So we came up with a number of quite specific recommendations on this topic. Again, as of the end of last year, we had 3 countries that still had not adopted national plans or strategies, but increasingly more and more countries, those plans where they're time bound are actually expiring. So around 7 were already expired last autumn. Another 10 had 2020 as their end point. So that's a real concern. So we have recommended in the project that we need a renewed momentum here, which should come from the European level first and then be embedded in the countries. We're recommending that all countries should have active, specific national plans with adequate funding to do what's in that plan, and also concrete objectives. We think more often than not, it's quite easy to develop these wonderful documents and they're not pushed forwards. We also think that we need a much stronger emphasis on implementing and evaluating the plans that we've had. And this really should be a multi-sectoral process. So yes, medical, but also research, social, employment, all of these areas. We really feel that patient partnerships are critical in all activities, and you'll see that across the full range of our recommendations, but particularly around evaluating past national plans and strategies, drafting the new ones, and supporting that implementation. That patient partnership has to be there. That's really important. It's not just about patient partnerships in research. Also importantly, we think that countries really need a suitable forum to try to have these debates, and that's something that we're lacking at the moment. Countries need to really be supported to think about what they could and should be putting into their next generation of plans and strategies compared to a decade ago. And we also recommend that looking forwards, we should recognise that very often there's no one size fits all in terms of what an ideal national plan or strategy would look for. So again, this forum really needs to facilitate discussion across countries so that countries can look at other countries of similar size, similar healthcare systems, similar geography, and see actually what they can do more collaboratively. And that ties in with our favoured scenario for the Rare 2030 project. If we don't act here, if we don't push in this direction, then we're going to end up in a scenario where, at best, each country continues to develop national plans or strategies on their own in isolation. And as we've seen in some of the countries, we'll end up in a situation where these policies expire and aren't replaced. So we really will, if we go down that route, we will miss that crucial knowledge of what kind of solutions fit which sorts of challenges. So do have a look at our specific recommendations in this area.
Thank you, Vicky. So we need a European strategy. We need a way to make sure that these European strategies are implemented nationally, and we need ways to monitor and see how this is really changing the lives of people with rare diseases. Very clear. So let's come on to recommendation 2. And we're back to the diagnosis issue. We're back to those little children we heard about, Isabel, Luca, Ursula, and Eric, and how they were diagnosed, what the individual factors were playing into whether or not they could achieve a diagnosis, when they were born, where they were born, and what opportunities were open to them. And of course, across this route, the issue is that there are continuous delays in diagnosis. We talk about a diagnostic odyssey for people with rare diseases, where maybe they see multiple clinicians and many different people in different healthcare settings before a diagnosis can be achieved. There used to be a real excuse for that because people didn't understand rare diseases. There were no specific diagnostic tools and so forth. And so when it was understandable, maybe it was a little bit more excusable, but it's not excusable nowadays. We've got much better tools for diagnosis, not only at the genetic level, but also immunologically based and so forth. And we've got a huge knowledge base to build on. So that's led to this ambitious goal. Let's see if we can really get a diagnosis within 6 months for people with rare diseases. Earlier, faster, and more accurate diagnosis. And to comment on that, we come to Maurizio. How do you think these recommendations will really improve access to diagnosis at the national level? This new baby born in 2030, little Eric, how's he going to work in all of this?
Well, Katie, thank you very much. I mean, this is really a crucial question, and it was very well introduced by Jan, by Vicky, by yourself, in highlighting really that it is intolerable that now in 2021 we are still having delays, we are still having misdiagnosis, we are still having miscommunication of diagnosis, and this is a major problem, and it is really a matter of equity. So this recommendation, and we were very lucky in having this program because we can really make a roadmap and pathway to improve the things, has highlighted that now this can be really changed because we are in a gold age, which is the age of networking. And as a matter of fact, as you said, all the technical problems can be overcome. It's only a matter of creating a good network between the different laboratories that are able to really have the diagnosis in a short time. We are also lucky because, I mean, we are entering in the last year of the European Reference Network, which have been launched already 4 years ago. Now we are in the 5th, and we are facing the next 5-year program, so the ERN 2.0. So we are really in a situation to actually have now a structure, which are the ERN, containing all the best expertise, technical, diagnostic, and clinical, and management multidisciplinary teams, in order to make really the difference. This is not enough, though, because I mean, to have a diagnosis, you really need to recognize the diagnosis. So I think that one of the major duty that we have, and the ERNs have this duty, is actually to increase the knowledge and to generate the knowledge on rare diseases. Still, rare diseases are just in a little corner of education programs in the universities, and they are disseminated throughout the different disciplines. They don't have a real topic for them. So what we have to do is to engage a sort of challenge in order to create a better awareness of what has been done so far, a more efficient one, in order that we create the suspect idea in our colleagues. We don't want general practitioners making diagnosis in their office, but actually to send to the expert centers the suspect about rare diseases. Another thing that is also important is to, and the technology is there, is actually to give the diagnosis as soon as possible, and possibly at birth. Now there are in Europe quite a lot of programs. There is a lot of work and movement about newborn screening. Of course, as metabolic ERN, we are particularly interested since 60 years about newborn screening. But I mean, this is not enough. We have technology, we have the possibility of highlighting the disease. What we have to know is what is the forecast of the disease, the prognosis. So we have quite a lot of work on the newborn screening to treat it not as a test, but as a system. And so to really give the good information to the couple to make a right diagnosis, and then to couple the couple with all the possible support, psychological and clinical, that they need. So I think that this recommendation is actually giving this way, and we have all the tools to do. And I think that 2030 is too late. We should aim to do all these things, you know, in the next 5 years, and possibly to give really the difference, to light the difference in shortening and making the diagnosis real, well communicated, and very well accepted by the parents.
That's a very positive statement, that these recommendations should actually come into force even quicker than the next 10 years. That's fantastic. And also amazing to think that the ERNs are 5 years old. All that push that we had to establish the ERNs, to get them going, and to feel that they're now a real resource which is at the heart of diagnosis and healthcare for people with rare diseases across Europe. And that brings us neatly to recommendation 3, which is all about access to high quality care, which is another area where the ERNs must be in the lead across Europe, and that their sustainability will be so important. It's still true, despite all of our efforts to put together the ERNs and to ensure that they cover all patients with rare diseases as much as possible, that there is still scattered expertise, there's still care that is missing in different places. There's still a goal that has to be that in this idea of social and health equality, every patient with a rare disease should have the right to healthcare, leaving no one behind. And so this kind of whole concept leads to the recommendation of an ecosystem with access to high quality care, where there's provision of all of these levels of support, not only at European levels, but also at national and regional levels, so that in those beautiful words, every patient with rare disease has a home. And once again, Maurizio, we'd like to hear from you. How do you think these recommendations will help to improve access to care for all people living in a rare disease, with that wonderful vision that we have, that everybody should have somewhere that they can turn to?
Well, Katie, even this is a milestone. I mean, there is no diagnosis without the therapy, and this is what we really want. We have a goal that every disease that we diagnose can have a therapy, whatever it will be, to help the child or the adult with rare diseases to live better. And it is a matter of equality. It's a matter of a civil right. Every citizen with a disease has the right to be treated. So it is indeed extremely important to take the recommendations that we have drafted in order to understand how the major problems that we have and we are countering now can be solved. The major problems are, for example, the availability of the drug, the supplement of the drug, and especially the different time that there is between the market access and the effective access to the drug, which sometimes is also a matter of reimbursement, is a matter of delay due to lack of regulation. So this is not only a medical problem, it is mostly a problem relying on the different system of the national health system that every member state have. Again, I think that the networking and the European Reference Network can help, because I mean, sometimes the access to therapy is not only because of reimbursement, but because there is not enough studies regarding the safety and the efficacy of these disorders. So there is a lack of HTA documents. There is a lack of efficacy plan that are really stating that a certain therapy is working. And for some reasons, for some of these reasons, some member states can actually decide to delay or to wait for therapy. At this point, what we have to do is to generate the data throughout Europe in a very organized way, in order that they can be used to understand the safety, the efficacy, and the quality of these drugs, and in order to create programs with HTA analysis that can be really supporting the access to therapy. So this is something that it's a major topic. Another major topic is to work with the patients and to have the patients working with the physicians in order to generate and to collect data from the real world data and the real evidence measures that can be used in order to testify and to state that the therapies are actually working. And for this reason, I think that the collaboration between the different patient organizations, the ERNs in trying ways of collecting this data and then to use it to make a request for therapy will be extremely important. And this is indeed, an alternative pathway, an alternative way, that because now we are not doing this, we're just trying to find new therapies, but then it is very difficult to understand whether these therapies are efficient as they are promising.
So there needs to be nowhere to hide. We need to understand how things work and make sure that they're implemented as quickly as possible and as reliably and in such a timely manner as possible. Really important, and a recommendation that I hope will be dear to everybody's heart as moving forward. It leads very much onto the concept also of integrated and patient-centric care, and this is crucial to the life of anybody living with a rare disease. People with rare diseases have vulnerability in many different ways. Vulnerability within the healthcare system, often vulnerability within the social system, and also where social systems aren't set up to support them, maybe also economic vulnerability. And these all have to be taken into account if we're really going to improve the lives of people with rare diseases. One of the major outcomes of the last 10 years, I think, was an increasing emphasis on social care and how important it was for people with rare diseases, so that healthcare should never be taken in isolation as the only issue of relevance. And I think that this recommendation, looking at an integrated and person-centered way of caring for people with rare diseases, will take that in both hands and hopefully give it a really good shake-up, leading to the implementation of EU and national actions, guaranteeing the integration of people living with rare disease in societies and economies. Because after all, that's what social justice and equality is all about. Giovanna Giuffre, who's been a major part of this Insight study, is going to comment on that. And maybe from a slightly different angle, a slight sort of where our wildcard was. How has this Foresight study prepared us for COVID as a wildcard in this process? Giovanna.
Thank you, Katie, for the question. And yes, we will see of how COVID is changing also healthcare and social system. What is a wildcard? In Foresight jargon, wildcards are defined as disruptive events with low probability of happening, but with high impacts expected when they do. So what happens if they actually occur? Take, for example, COVID-19. Events like these provoke drastic change and modify how structural trends develop. In an unexpected way, some go faster, some will slow down, new trends emerge. By offering a detailed analysis of trends relevant for patients with rare disease, the RARE 2030 study provides a framework for understanding and evaluating the challenge and the opportunities that have emerged from COVID-19 crisis. In the light of this, RARE 2030 policy recommendation can be read. In COVID-19, we do see the risk of acceleration of trend of increased inequality and reduced cohesion. But we also witness opportunities arising from trend linked with digital health, artificial intelligence, multi-stakeholder collaboration in research. This aligns with and complements the approach proposed by the European Commission in its 2020 Strategic Foresight report, charting the course toward a more resilient Europe, which aims to offer a comprehensive view of the impact of COVID-19 in order to ensure that short-term initiatives are grounded in a longer-term perspective. And I quote, "Resilience is the ability not only to withstand and cope with the challenge, but also to undergo transition in a sustainable, fair, and democratic manner." RARE 2030 recommendation devise action and strategy that seeks to counter inequalities and promote cohesion in institutional and legal structure in 8 key areas. Recognizing the need of patients with rare disease in different areas and fields is a sign of understanding, anticipating, monitoring, and minimizing the impact of the crisis, especially for those highly vulnerable groups, as called for by the European Commission Expert Group Joint Opinion Improving Pandemic Preparedness and Management report. On the other hand, a key policy lesson that we can take from this crisis is that further collaboration is required in Europe to face health challenges that require a multi-stakeholder, holistic and comprehensive approach. The knowledge that that the rare communities has can be used as a leading example and support the development of rapid and effective change in health at the European level. And from this change will benefit both rare disease patients and European citizens as a whole. And I'm afraid that all this presentation was also with my dog on the back. I'm sorry. This is let's say the COVID pandemic impact in another field that we're working from home. So I have a dog. I'm sorry.
The dog was your wild card, Giovanna, and you showed remarkable resilience in carrying on. So
no, yeah, I'm sorry. It's really, I could not stop him in any way. So.
No, I mean, I think the message came over loud and clear. We need resilience. We need resilience of our population. We need resilience of our healthcare services. We need resilience to stand up not only to the day-to-day demands, but also to the demands of that wild card, of that pandemic that you cannot see coming and that you can't control for. And hopefully these recommendations will embed that resilience into the care for rare disease patients over the coming years. Partnership with patients. This is such an important point. We've made huge strides in this area since really patient participation was nothing more than a tick box on a form. We now see that patients are experts in their diseases. We see that it's of benefit to us all to work in partnership with patients, and whether that's in designing care, designing research, and setting up leadership programs for people living with rare diseases, not only in the public sector, in the way our hospitals run, but also in the private sectors when it comes to drug development and the rolling out of new therapies. And this is what we want to see, a vision whereby all patients and their representatives can find their opportunity to provide expertise, whether it be at a local level, at a national level, or on an international stage. And you only have to look at the example of Eurodis bringing together so many different rare disease patient organisations to see just how powerful this can be, not only on a European stage, but also globally. So our recommendation in this area is around the culturing of the meaningful patient partnerships, which really only serve to drive forward the agenda for everybody. And speaking to this, we have Jan, who has led so much in this area. So Jan, how is partnering with patients integrated across these recommendations?
It is, and in fact, the increased rare disease patients, the increasingly empowered patient organizations or patient advocates was identified as one of the 12 trends in our ecosystem during the study. What this recommendation 5 is about is the change from collaboration to partnering. And that's a major change because it's moving from patients being a curiosity or tolerated in a scientific committee, in a governing board, in a project, to becoming an equal partner. And if I refer to what Mauricio Scarpa was just saying, the golden age of networking, mutual respect within network is a key success factor because it's a give and take, it's a co-construction, it's collaboration. And the knowledge and experience of people living with a rare disease is a valuable asset for all the partners in the network or in the activity. So the recommendation on partnering with patients goes across the different recommendations in the RARE 2030, which is research, healthcare, also social services, and all innovative solutions. In other words, what we need for the condition of success is a change of culture, for an active and meaningful participation of patients. It's an engagement of the public and private actors to support financially, but also with responsible policy, the information, the training, the capacity building. 2 quick examples. The measurements, the co-development of patients-reported outcome measures, the PROMs, or the patients-reported experience measures, the PRAMs, which are more in the patient journey or healthcare pathway in the healthcare system or social system. These kind of co-development are essential to be really meaningful, and they can be applied for research or product development. Also, another example is to have the patient representative as equal partner in the governing bodies of the European funds networks, not only for the networks themselves, but for some of the activities, like when working, for instance, on the patient journey and healthcare pathway, working on good diagnostic and medical practices, or working on registries and data collection.
Yeah, no, I mean, partnership with patients has to be the key word, doesn't it? Partnership which is meaningful and which is on an equal basis, not, as we said before, this tick box exercise. And that's the way that everybody will gain more out of this whole process. So let's move now towards the areas of research and development. And in that social justice scenario, the concept that these should be innovative and needs-led, not towards the development, not towards profit only as a driver. So we know that in rare disease research and innovation, there has been a lack of investment. There's been a lack of coordination, and that this has led to the problem that people with rare diseases have benefited less from innovation and the outcomes of research than maybe patients with other disease areas. So the goal and vision here is all about maintaining a priority for rare disease research, whether it be at the basic level, the clinical level, or at the social or translational level. And this is going to call for increased funds, increased incentives for people to become involved in this disease area, and the supportive infrastructures required to expedite discovery and knowledge acquisition. And again, coming back to that social justice, that equality, this should be available. These sorts of outputs should be available for everybody. These need to be innovative and needs-led in terms of their research planning and development. And there needs to be a structure and a strategy upon which this can be based, not a piecemeal way through this area. And who better to comment on this than Lucia Monaco? Lucia, how do we make a true paradigm shift in research for rare diseases so that no one is left behind?
Thank you very much, Katie. Our recommendations address all components of the complex research and development ecosystem. Great advancement in research and a body of knowledge on rare diseases, research infrastructures are already available. But we need to build on them, and in order to make the most out of them, we need to apply three overarching concepts: support, prioritization, and collaboration. First of all, basic clinical and translational research must be maintained as a priority and supported by important investment based on strategic analysis. And this is a fundamental concept. The strategic analysis must be aimed at identifying the unmet needs, at defining the priority areas with particular attention to diseases that are neglected by research and development. And also, it's important avoiding duplication of efforts. To accelerate excellent science in rare disease domain, funders shall support the translation of innovation from bench to the clinic and promote access to existing infrastructures which need to be maintained and developed. And also here, coordination, sharing of information, facilitating access to available resources will be key. Funding bodies will implement existing recommendations and guidelines that are already here that come from international bodies, such as their recommended resources, for instance. A very relevant concept is that clinical care must be linked to research. And here the European research networks play a very important role. Year ends shall be supported not only by member states, but also by a centralized research support service with earmarked funds for clinical research and natural history research that must be made available to year ends. Of course, collaboration with industry must be pursued through a collaborative efforts between academia and companies. Also, it will be very important to promote research in public health, social sciences, healthcare organization, health economics, and health policy research in order to make sure that the outputs of research are effectively applied for the benefit of people living with the rare disease. In conclusion and overall, only through a coordinated and balanced efforts for all of these recommendations, it will be possible to reach the desired scenario of investment for social justice.
Thank you, Lucia. So important to have this holistic view of research, seeing it go right across the patient pathway from the clinical side right through to the bench that we often put first. But actually, it's the patient at the centre of all of this, and that's what we need to have in our minds as we think about these recommendations moving forward. So the seventh recommendation is around data. We have data all around us in our world now, and how do we optimize this data for benefit not only of the patient, but also of society? So the issue here is that no matter how much we try to coordinate things and how much effort has gone into this in the past, data remains scattered. There's huge amounts of data out there, but they don't necessarily meet each other and come together to form the kind of logical way forward for answering research questions or answering questions for patients now. There's also data lacking. We sometimes come back to ask the most simple questions. If a clinical trial is being designed, for example, we sometimes find that we don't understand natural history nearly as much as we thought we did. But yet there would have been ways to collect data on those sorts of outputs if we'd only thought of a critical mass, a way to get that critical mass together ahead of time. And this is an ambitious goal. It's such an ambitious goal that all European data sources of relevance should be federated in some way, with linkage at the global level where possible. We believe very strongly in the sharing of data safely in an optimized way across infrastructures and countries. And of course, underlying all of that is that data should talk to each other, so therefore should adopt some common ways to be codified so that data can talk, one piece of data can talk to another. So this is all about optimizing data for patients and societal benefit. And Orphanet has been working on this issue for many, many years. So Anna, how do we make the most of data, and how can these recommendations really push that forward?
Oh, thank you, Katie. So yeah, that is a very important point, because data is instrumental for any other action recommended here. And as you very nicely said, there is a lot of data out there. But however, a good quality data and reusable data is rare, as it's like gold. And we need to make it happen that people producing and collecting data become like alchemists. So transforming data in gold according to gold standards. So taking care of the data locally according to international agreed standards. And that is the way we build interoperability. So we need data custodians to take care of data in order to make the most value out of it. And we talk here about social value in a social justice scenario. My data has no value because it is mine. It has value because it is valuable in a marketplace. The value of data lays on the capacity to transform data into knowledge. And that is what we need now to really go to this paradigm shift. So fundamentally, the first thing is to incentivize the value of data by investing in these alchemists, so data stewards and data standards. The paradigm shift is cultural, the culture of quality of data, making data that is of good quality enough to be shared, and the value of sharing that needs data governance, and data governance needs multi-stakeholders dialogue, including patient preferences. If we want culture to change, we need a political will to do so. And the means of the political will that are the incentives. So really money should go to improve quality of data at the source, making that findable, accessible, interoperable, and reusable, so fair, compliant. And then we need to think in defragmentation. And defragmentation is not centralization, which is not doable, not cost efficient, but as a federation in an ecosystem that goes beyond the boundaries of a country, that is really a transnational federated data ecosystem. We don't need to collect everything all the time. We need data to be ready to produce knowledge, to answer the right question at the right moment. And we don't need to demonstrate that because COVID did it for us. And for that, we need the right questions. What means a needs-driven approach of data. In the recommendations, RED 2030 project has already identified a set of questions that data should be ready to respond in the future. So to conclude, I would say that at the time, at different paces, countries and Europe are embarked in digitalization process, including rare disease specificities in data collection is doable, and rare diseases are an exemplary use case in sharing health data across borders. But that needs incentives. So I think that not doing so for rare diseases would be unethical at this time. Thank you, Katie.
Thank you, Anna. Yeah, that's a really important point, isn't it? That we are custodians of these data. They don't belong to us. They belong to the patient. They belong to the community. And making sure that our sharing is done in a meaningful way for the right reasons is probably the most we can hope to achieve and the best that we can hope to achieve as time goes on. There's no doubt that data sharing will help us with our next recommendation. And actually, all of these recommendations are interlinked. You don't get new treatments without identifying the patients. You don't get new treatments to the patient without the use of data. You don't get new treatments to patients without the input of patients themselves in the sorts of the study and the design of trials. But we all hope for a day when there will be many, many more specific treatments for patients with rare diseases. So there are still so many significant unmet needs in this area. So few rare diseases actually have specific therapies which have been designed or tested specifically for them, which is why this has to once again have a very, very aspirational goal. 1,000 new therapies, but not only 1,000 new therapies, more affordable therapies. Therapies that can be actually delivered to patients because they're within the ability of healthcare systems to fund them. And these recommendations, therefore, go along a much more of a point of thinking about streamlined regulation, streamlined pricing and reimbursement, a continuum of evidence generation, and a European ecosystem whereby people can safely and attractively invest, and where innovation is beautifully fostered and sustainable. Because we all want what this recommendation is pointing to, which is available, accessible, and affordable treatments to as many people with rare diseases as we can possibly manage. And we're going to come back to Lucia to comment on this. How do you believe, Lucia, that these recommendations could improve the development of and access to treatments?
Thank you, Kati. I think that here the two key words that are important to improve the triple A's for treatment, availability, access, and affordability, are European and policies. And here again, multi-stakeholder identification of unmet needs and priorities of investment will be key to guiding incentives in favor of areas with no therapeutic options, while avoiding artificial breakdown of common diseases into rare subsets. It's very important to work at the revision of the regulatory frameworks on orphan medicinal products, but also to maintain and sustain the current positive aspects of these regulations and maintain adaptive pathways, rapid access to mechanisms, while keeping, of course, safeguarding the safety and efficacy of treatments.
Fantastic.
Using and building upon existing resources will accelerate the process. So there are resources out there already, and we have to make the most out of them. For example, the IRDIRC Orphan Drug Development Guidebook, or regarding repurposing the experience built by the STAMP initiative, by the expert group, or by IRDIRC and other initiatives. The access to treatments will be facilitated by stimulating transparency in the decision-making process for orphan drugs through European collaboration among the health technology assessment bodies. And regarding the affordability, the pricing should be negotiated at European level based on companies' transparency on development cost and on a continuous value-based approach. Also, the launch and post-marketing assessment of orphan medicinal products must rely on interoperable and federated data. Very important, as we've just heard from Anna. Gene, cell, and tissue therapies will become more and more numerous, and that will require dedicated policies to facilitate cross-country collaborations, to allow reimbursement of patients receiving care in a different country, and also to allow the generation of initial post-marketing authorization evidence, especially for the rarest of diseases. Finally, the development, accessibility, and availability of medical devices for rare diseases should be addressed at European level. And so to conclude, pan-European and where possible global coordination in setting policies will reduce fragmentation and inequalities in availability, access, and affordability of treatment for rare diseases.
Thank you. So again, talking about equality of access, the science drives sometimes the way forward in the terms of developing treatments, but we need the policies to be ahead of the science, alongside the science, in supporting the way that these beautiful scientific developments can actually be translated into something which helps the patient sitting in front of us in clinic. And that's the way that these recommendations look at it. And that's the way that we want to see things go for this beautiful idea of every patient getting access to the treatment to which they are entitled and which they need. Now we come on to, we've finished the romp through the recommendations. You'll have an opportunity to go into them in more detail in breakout sessions later. But we really wanted to highlight in this discussion the voice of the young citizens. And you'll find in the executive summary of the recommendations an open letter from the Rare 2030 young citizens who've played a really important role in shaping the recommendations and throwing us old people a curved ball in trying to see, where could we have done things better in the past and where can these wonderful young people take things forward in the future. So Fanny Laura, the question for you is around the future, of course. How will the Rare 2030 recommendations help achieve the expectations of your generation?
Thank you, Katie. The Rare 2030 recommendations go very well in hand with the expectations and needs of the younger generations. The Young Citizens panel would, however, go a step further. We recommend gathering expertise, means, and resources into one single European agency that would manage and be responsible for all the aspects of rare diseases across Europe, the EU Rare Disease Agency. In line with the Rare 2030 recommendations, a first focus area I'd like to raise is to clarify and reframe the role of the ERNs. Although the role of the European reference networks is known, we recommend clarifying how individuals can adequately use these platforms. A more inclusive and collaborative platform based on dialogue helps promote better care for all people living with a rare disease. Along with collaboration on European level, there's a need for more collaboration on the ground level as well. A second focus area, in line with the theme of the Rare Disease Day, would be to reframe what it means to live with a rare disease, considering domains such as holistic care and the different daily patients' needs that are currently not either clearly understood or addressed in policy, such as mental health. Psychosocial support should be provided as a standard for any patient and caregiver, and the toll of an illness recognized as more than just the somatic symptoms. The Rare 2030 recommendations with an inclusive and collaborative approach can be a key factor in actively spreading awareness to debunk stereotypes and stigmas. Last but not least, through incentives or other political means, we need to foster public and private efforts to collaborate on issues through a strategic framework that puts the emphasis on and rewards collaboration. It is important that the different stakeholders unite and see the commonalities in their efforts, even with differences they may have in detail. Just putting it out there, an agency as a more organized and joint front would be perfect for this. Now, I'd like to note, however, that the agency suggested by the panel of young citizens should be a progress where you can add more as it grows and as is needed. What we have in mind is an umbrella of joint action and individuals collaborating, a united willingness instead of something stiff, an institution just for the sake of an institution. The Rare 2030 recommendations speak loudly for the expectations of the young generations, and we urge for implementation. The process of delivering the recommendations by engaging a whole community of experts, patients, scientists, policymakers, and the young willing to contribute is already a tribute that should not be taken lightly. As a final testament, I'd like all of us to remember how not so long ago where we held our meetings such as this online. It is now the norm. The future of rare disease should be about moving the knowledge, not the patient.
Thank you. I mean, I can't thank you enough, you and the Young Citizens panel, for the input that you've had to these recommendations. Your extra vision and your drive and your enthusiasm has fed fantastically into the project, and it's just been wonderful to see it. The challenges that you've put down are really appropriate, and best of all, you lot are going to be the people who enact them. So good luck for the next 10 years as you help with the enactment of these strategies towards a world where collaboration and holistic care is the norm. So thank you so much. So the Rare 2030 recommendations, I hope you've gathered from this overview that they do consider the full ecosystem. They look at rare diseases in the round. They look at the whole pathway. there are different health programs which are already in place, and the rare disease recommendations don't seek to overtake any of those or take any of the thunder from those other programs, but rather complement them and bring a rare disease specificity to what can already be achieved in many other ways. It's important that these recommendations are wholly in line with the UN Sustainable Development Goals, and therefore should be a part of that thinking as well. And once again, coming back to this thought that we aspire to leave no European citizen behind. This is what is at the heart of the social justice message for rare diseases, and at the heart of these recommendations, which we really hope are picked up quickly and moved forward with. So you're going to have lots of opportunity later to speak to some of these experts in more detail. Just to remind you that these breakout sessions will happen later on this afternoon, and that you will be able to join in with with topics across these different recommendations, and give your input and thoughts into the way forward. Because this programme will only work with the collaboration of everybody. Everybody moving forward together is what will really make these recommendations a reality and change things for those people living with rare diseases in the coming years and now. Thank you.
Thank you very much, Kate, and to all the members of the panel, to Jan, Anna, Lucia, Maurizio, Fanny, Laura, Giovanna and Victoria for taking us through these different recommendations of the Rare 2030 project, and giving us a little bit more depth and background to each of us and reminding us why it's so important. We had some great content in the chat, and I encourage all of you at home to share your thoughts, your reflections and your comments in the chat box, because we can use this to help build the advocacy campaign afterwards to take it forward. And I've noted several points that you've brought up in reference to the different recommendations. We'd now like to, you've sat and had a chance to listen to the speakers. I'd like to bring you, the audience, back in at this point, and we're going to have some more of our interactive activities. So if you could, we're going to ask you some questions. And the first one, we'd like to know a little bit more about you. We know that we had about 600 or more people watching a little while ago, and we want to know, who are you? So the first question we're going to ask you is, which stakeholder group do you represent? And this is so that we understand, whether we've got researchers, we've got patients, policymakers, clinicians, get a sense of who you are so that we know who's in the audience. So you should be able to see a poll which asks you which stakeholder group you are part of. So we have something going on, but I don't think it's quite the poll yet. Could we launch the polls? Which stakeholder group do you represent? I apologise, we seem to have a disconnect between what I was hoping was going to be coming up and what we have now, because now we have something where we're inviting people to notice how they think things will go. Let's see if we can relaunch a poll. I'm not sure what question we're asking people here. Yeah. The type of stakeholder that they represent. Okay. We're now going to move on to the next elements. Just to remind you, the different aspects we talked about in these recommendations, I think something that came through very clearly was the ambition here, that there is a role for Europe, and several of the comments talked about how Europe relates to the national level. We heard from one of the members of the panel that even though it was back in 2008, there was the recommendations that every country should have a national strategy, we still didn't get all members of the European Union countries having a national strategy, and about 17 of them have either expired or are expired at the end of 2020. So we have still a long way to go. And I think the recommendation number 1 about the need for a new European framework is so important in that context, because it's at European level that you can set the type of ambition that could go into either a renewed plan at national level or fill in the gaps in what exists there. And I'm going to invite our next speaker, who will be joining us in a few seconds, André Ries, who is the director in DG Santé, responsible for health systems, medical products and innovation. And I'm going to be asking him what he thought of the messages from the panel and how Europe could take these recommendations and use them to implement some of the gaps that the European Court of Auditors identified. So, André, first of all, welcome and thank you for being with us this afternoon. I hope you had a chance to listen to our panel discussions, where we had each of those recommendations. We identified why that was so important and what it actually meant for a new framework. André, what are your comments when you heard all the messages about the recommendations?
Good afternoon, everybody. It's a pleasure to be in this meeting. So I hope you can see me because I'm connected.
We can see you and we can hear you, André.
Oh, okay, so this is a huge harvest of the knowledge this project was able to create. I really congratulate the all co-creators, because I think it's as usual in such harvest, it's important to recognize that every individual, I think, voice was heard and some kind notified, and now you brought with this recommendations. And I'm sure that the number of those recommendations, first they fit purpose, and the second they are available, for our policy development. I really feel, the messages passed from the panel, the last one about we say that we would like to allow the access to patients for the right diagnosis and treatment, but it was reminded us by young generation that we want knowledge travel, and this is knowledge travel easier than patience, and we should continue to push this agenda. Unfortunately, the COVID also stopped our new effort for support, exchange of expertise through the physical presence of clinicians, moving from one country to other, from center to center, bringing the knowledge, teaching new technologies, helping with the diagnostic tools or ideas how to organize the care. But we hope that this shortly COVID situation allows this part of year-end's work continue. The second important message I heard was about the golden age of networking. I fully support what was said by Vicky, by Mauricio. It's clearly the year-end is the best example. This networking makes sense. It's helped us to develop things. It's give additional value to the patients, to the clinicians, and we should continue. But of course, as any system, year-end also has to be carefully assessed and what. So Court of Auditors colleague mentioned the report and the recommendations. One of them was about the national contact points and strengthening access to the knowledge information about rare disease treatment, about year-end's work. This is what we are doing. We try to push this agenda, and we continue to meet national contact points, support them with all kinds of again knowledge and excellence. How to do this better for patients. We announced also the assessment of the regular framework. Cross-border healthcare directive is an important base for the ERS, but not only. It's important for the patients' cross-border healthcare. So we will see, what this assessment will tell us. What has to be addressed for the future. What should be changed. Additional issues, relations between different level of governance and access and work. At the European level, I think we are able to establish this 24 networks, over 900 centers already joining the. Hundreds of new are coming as affiliated partners, new members. So hopefully soon the whole assessment process will be finished and they will join the networks formally. It will allow, spread the networks, European reference network across Europe, but of course, without involvement of regional, national, and sometimes even quite local involvement on the hospital level, it will not improve. So we need this, and I think it's important. This also is addressed in the recommendation. So we are going to push this through the joint actions, which will be funded through the new health program. And it's also important to say the new health program, EU for Health, is also having ERNs as one of the flagship we like to support. And I think it's important that the resources budget is there. And let me also mention that something which I think Jan addressed in the beginning of this debate. We need also evidence, and we need clearly to assess what we are doing. So, as you know, by law, by legislation, the European Reference Network will go through the full assessment, in-depth assessment of performance in next 2 years. In 2022, the framework is under development, and we will see how we can see the system is working also from this performance point of view. I think it's and the last thing I would like to say. We should not forget about the different regulatory developments. We have clinical trials regulations coming, in force beginning of next year. So we have to use this opportunity for the cross-border multinational studies, which are coming with a quite established IT system to support it. But we need knowledge, again, we need trainings, we need all systems in place to function. HTA, Health Technology Assessment Regulation, is under discussion in the Council and Parliament. Hopefully gets soon to the final. Orphan and pediatrics regulations is now under, after evaluation, now we start to propose potential changes. We address them in an inception impact assessment end of last year. And finally, by end of this year, we would like to propose European health data space. And I think I will refer to Anna. She said about federated data. This is one of the concepts we like to explore and bring, everyone who can produce data, quality data, share them with others to produce better results. Let me conclude with I think something which is in the bottom of my heart. I am in this journey with you since almost beginning. I had a chance to co-create the 2008 policy by the European Commission. I was able to work on the European Reference Networks development. But what is important, I think that the key message in the end is that behind all factors, successful factors, are people. So let me address it with my last point. Big invitations to everyone who is contributing to this development, to patients, clinicians, researchers. I would like to address especially European Reference Networks coordinators, hospital managers, who are trying to help and push this agenda together with us. Finally, policymakers on different levels, national, European level, and of course to all of you. And I think this journey is not ending. So I will invite you to continue and be together, because only networking is going to make us working better in the goals you establish in this great project. Thank you very much.
Thank you, Andrei. And of course, as you said, you've been involved in public health at EU level for some time, and you've seen the progress that's been delivered since the 2008 recommendations. And there's a long way to go yet, but just getting a chance to look back and see what progress has happened. And if the last 12 months has taught us anything, it shows us that when the will is there and the energy is there, huge amounts of things can happen. The barriers that existed disappear, and the power of collaboration, the golden age of networking, sharing data, sharing information, sharing capacity, has really reached a new level at within European policy circles. And let's hope we can harness some of that momentum for rare diseases. To use the message that Rebecca gave us earlier, if we can maintain a protective hand over the rare disease community, so that in the scramble post-COVID to reconfigure our health systems to prepare for another pandemic or another big threat, that we don't lose the uniqueness that can be there about managing to confederate our information and efforts for rare diseases, because there are huge benefits for the rest of our system. So a final plea to keep, André, to keep being our champion within the Commission and keep, rare diseases on the agenda amongst the many other issues that are being discussed in the next 12 months. Thank you very much, André, for being here. And to the team in DG Santé, we had the Commissioner on earlier also giving her strong support. We know that DG Santé has got a commitment to rare diseases. Let me now turn to the audience, and I apologise if it wasn't as smooth as we hoped, but we have seen the results of the interactivity, and we can see that you, the audience, are very strongly patient networks and patient representatives. I think at least half of the answers that came in from that. We also had representatives of the pharma industry and a private sector. We have some clinicians and academics and other researchers. We wanted to know, had you contributed to the recommendations? And about a third of you had, but 2/3 hadn't, which meant our opportunity to present them to you was valuable because you hadn't seen them before. But I hope you found yourself included in them and recognised the value of them. And then finally, we asked perhaps your level of optimism, because we asked, how likely do you think these recommendations will lead to our preferred scenario, where we're looking at a needs-based innovative model that is inclusive? And again, we've got sort of, if 4 or 5 stars shows that people think it's highly likely, the majority of the audience, and again, perhaps that's because you were optimistic, as we saw at the beginning of the day when we asked you how you felt, but a strong message saw that if those recommendations are implemented, 3/4 of you feel that this would make a real change and impact in the lives of rare disease patients and their families. I'm going to, just before we close this session, I think it's really important that we hear from some of the young advocates who are both involved in the Rare 2030 project and are also the ones who are going to live the longest with the impact of what's going on, because I remind you that rare diseases is an issue that overwhelmingly affects the younger generations. And we've gathered together a short video called 23 Voices with messages from some of the younger generation of advocates who participated. Let's hear what their expectations and ambitions are for Rare 2030.
Dear members of the European Parliament,
dear European Commissioners, dear present policymakers and leaders.
You have done tremendous work in the past decades to improve the lives of people living with a rare disease in Europe.
However, the world we live in today is different than the one we knew back then.
With the emergence of new contexts, challenges, but also new opportunities.
We need to further concentrate actions to guarantee that Europe is indeed a place where no one, including people with a rare disease, are left behind.
It has taken a generation to get where we are.
Now it's time to listen what we, the Rare 2030 young citizens, and the next generation of health and social care providers have to say about the future.
In 10 years' time, I will still be living with a rare disease. I may also be a parent of a child living with a rare disease.
In 10 years' time, we will have lost too many of our peers too early to rare diseases.
By 2030, I want to live in an inclusive society that recognizes all my needs and acknowledges that my condition goes beyond physiological symptoms.
I want to have access to the right diagnosis quickly and to be given the appropriate and effective treatment options wherever I live and whatever my socio-economic status may be.
In 10 years' time, I will be a doctor, I will be a nurse, a psychologist.
By 2030, I want to work and collaborate with colleagues in my country and throughout Europe who have solutions when faced with rare diseases, to whom rare diseases are not a mystery.
I want us, health and social care providers, to become the best versions of our professions with the tools and mindsets needed to make sure that our patients can live the healthiest and happiest life they can.
In 10 years' time, I will be a policymaker.
By 2030, I want rare diseases to be seen as a public health priority.
I want Europe to be an example of fairness, equity, and inclusiveness in all areas, having an impact on the lives of people living with a rare disease.
I want the benefits of cross-border collaboration to be recognised and obvious, no longer a proof of concept.
We, the Rare 2030 young citizens, come from different backgrounds, different countries, and have different experiences with rare diseases.
We are the next generation of patients, patient advocates, doctors, nurses, psychologists, policy advisors, and policymakers.
We want to be the generation of change.
As the leaders of today, you can make a meaningful difference.
To drive change for our generation and the generations of rare disease patients, carers, doctors, and policymakers to come.
Dear members of the European Parliament, dear European Commissioners, dear present policymakers, and those leaders.
Please don't let the health and well-being of 30 million people living with a rare disease in Europe be left to luck or chance.
Consider our words in your policy changes today.
Thank you very much for those very powerful and very clear messages from the next generation of people who are going to live and work and challenge the situation for rare disease patients in Europe. And I think they represent some of the emotions that we had at the beginning when we asked you, how are you feeling right now? And there was messages of ambition and hopeful and committed and enthusiastic and energetic and curious. And I think that video with the young advocates really clearly showed how those emotions could translate into real ambitions for change. And that's what this programme is about. So I'd like to thank everyone who was involved in this first part of the opening plenary. I think you find it was very interesting, very powerful, a lot of relevant information. But let's find out from you. We're going to ask you, did this session meet your expectations? And you're invited to vote and show us in a number of stars. Did we meet what you hoped at the beginning when we asked you how you were feeling and what you wanted from this? And just to let you know what's going to happen for the rest of the day, we're going to invite you to take a short health break, a 10-15 minute break, to get up, move around, get yourself some water, and to get your energy ready, because you're about to go into some parallel breakout sessions where we'll have an opportunity to explore some of these recommendations in detail. So there'll be about an hour to an hour and a half in a breakout session, and then we'll have another short break and a chance to come back into the plenary to wrap all this up and see where do we go from here. And everything you've put in the chat was extremely useful. Thank you. We will keep that and use that. As you go into your breakout sessions, obviously there will be smaller groups and there'll be more opportunity for you to have your say. And we strongly encourage you to go and be ready to be active in your breakout groups. You can see on the screen now, you have a choice of 7 different groups, and you're welcome to go to whichever breakout session you would like. You need to look on the screen and you'll see their numbers 1 through 7. And then you'll be able to choose which breakout room to go into. So in a moment, we'll have a break, and just be ready at 4 o'clock to go into the breakout session of your choice. And there we very much depend on your active participation to take these recommendations and explore how do we make them concrete reality. The breakout sessions will finish at 5:30, and then at 5:45, you'll come back here to join me here in the plenary, and we'll explore what next and how do we make this happen. Thank you very much for being with us, and we encourage you to keep the conversation going on the social media using the Rare2030 hashtag. Have a good break. See you in the breakout sessions at 4 o'clock. Take note again of which room you want to go into, and have a good session. Thank you. Bye. Hello everyone, and welcome back. I hope you've had a fascinating time in the breakout rooms. There were 7 different groups, and I'm sure you've had some really rich and intense conversations. Just to remind you, at the beginning of this afternoon, it feels like a long time ago, at 1:30, we asked you, how are you feeling today? And I just want to share with you again to remind you when we asked you how you were feeling, people were feeling optimistic, curious, empowered, energized, collaborative, determined and motivated. So this is how people were feeling right at the beginning of the day, and this is still a live poll. You can tell us how you're feeling after an afternoon's discussion. And just as a reminder, this is the final conference to the RARE 2030 project, which has been running for 2 years, which has been a major effort that's been iterative, it's been inclusive, it has engaged young people, researchers, policymakers, clinicians, all developing different scenarios and identifying which scenario would deliver the best impact for rare disease patients and their families. So here we go. At the end of today, we asked you how you were feeling. We have lots of positive and strong feelings from you. But now let's narrow down into the results of the breakout groups, because those were designed to help take these recommendations and illustrate them in concrete ways so people could understand what kind of an impact it would have on people's lives. So here's a poll. We're now going to ask you, how useful were the breakout sessions in providing you that kind of concrete understanding of how the recommendations would make a difference in a real life setting? And we're inviting you to use a 5-star process. If 5 stars means that it was extremely useful, you understood it, you integrated, and 1 star means that it wasn't as concrete as you wanted, it didn't help you understand how these recommendations would make a difference in your everyday life. That's useful for us and for the Eurodis team to explore, because it gives us insight as to how much we need to develop these recommendations further through case studies or something else. And as a reminder, we began today with the story of 4 children, born decades apart and into different worlds. We had the story of Isabel, who was born in 2010, who had a diagnostic journey of 10 years. And it took a long time. And by careful looking around, her parents managed to find a patient group online that helped and supported. But generally, Isabel and her family felt isolated. The dots were not connected between health and social care. The data wasn't there. They didn't have access to specialist support. So in 2010, life was a very challenging, isolating journey for Isabel. Fast forwarding to 2020, and there we could see that there was a different story for Luca and for Ursula. Luca was born in Italy, and there was newborn screening, so he had a much faster diagnosis, which meant he had access to more appropriate cares and treatments and options that allowed his family to make decisions about where they lived, whether they could integrate with their workload and how they could manage the condition. There was some educational support. Whereas Ursula, born in Poland, didn't have that same support, didn't have access to newborn screening. It took 4 years to get a diagnosis. And in that time, opportunities for early interventions were lost. She didn't manage to get integrated in a clinical trial because there wasn't the support from a patient group that could help her with a clinician who could understand it. And all of those experiences and these recommendations we've put on the table are designed to lead to a future, a desired future in 2030, where a child is born, Eric, in the Czech Republic, because every country has newborn screening. There's a fast diagnosis. Within 6 months, his parents and the healthcare workers treating him know what the condition is. They know what appropriate care options are available. The family's involved and engaged and has access to clinical trials, and there are new treatments that have been developed in the meantime. Eric's data is contributed to a larger pool of data which is used and analysed to develop new knowledge. And he and his family are valued in society, they're included, they feel all the support that they need, whether it's in education or for other aspects of life. So that's the future we were looking for. And I see that you've given us 3.5 out of 5 stars. That tells us that we've helped you to understand how these recommendations will make a difference, but we still need to go some way in making it more real, more vivid experience, so that we can help people advocate clearly for why this would make a big difference in their lives. We're going to ask you a second question, because these recommendations were built by you, by the rare disease community over the last 2 years. So now we want to know, what are you going to do with them? How would you take these recommendations forward? And we're going to give you choices for different actions that you might want to take, because there will be no momentum unless we as a community can reach out and engage and get things going. Otherwise, this will be a report that sits on a shelf. And if we want to achieve the outcomes for a child called Eric in 2030, we have to take actions now. So the question we're going to ask you, how do you plan to take these recommendations forward? Are you going to refer to these recommendations to guide implementation of national policy? Are you going to participate in follow-up campaigns in 2021 and 2022? Or do you have other plans about how you could take these recommendations forward? So here we're looking for the answers from you, what you think you could do with them. You gave us 3.5 out of 5 stars when in giving you concrete examples of how these recommendations could make a difference. Now let's see what suggestions you have about how to take them forward. So are you looking to be part of an ongoing campaign, perhaps at European level? Or are you going to focus more about delivering change at national level, particularly given the message we heard earlier that we've got 7 national plans that have already expired, 10 that were expiring at the end of 2020, and 3 countries that didn't have a plan at all. So clearly there's some room there to put pressure at national level to come up with a strategic plan. So we're still looking for input from your side, how you think you could take these recommendations forward. And so far we've got about 15% of people who've said other. Tell us in the chat what other means. What other suggestions do you have about what we could do with these recommendations? How we could make sure they land on the right desk of the right decision makers at the right time. Because the recommendations, if we can implement them, and they're all interconnected, you can't have one recommendation without the others. If we can make progress on all of them, then they all become more achievable. So questions in the chat or suggestions, what else could be done to take these recommendations forward? And this poll will be left open, so feel free to add comments in the chat there and we'll pick up on them later. The assignments that we have for you, and we started today with assignments, was to say, what would be your takeaways, your key learnings that you were going to take from this? What other types of actions could you take? And we'll see if we can build them into a campaign. We've said here that there'll be a follow-up campaign in 2021 and 22. So let's see what we would do. We've had somebody in the chat said the possibility to refer to the recommendations to guide EU policies and developments and should be present. And that's why they've selected others. So here we've got a message that using the recommendations to push for change at EU level is as important as doing it at national level. So thank you for that. And you've heard key messages from the Commissioner herself and members of the European Parliament earlier today about how they see this as being important. So we certainly need to keep making an effort at European level. And in fact, I think that gives us a nice bridge for me to introduce our next speaker, who's a member of the European Parliament, Kateřina Konečná, from the Czech Republic, which is a forthcoming presidency. But before I do that, I just want to say that the formal part of our agenda will end at 6:30, but we're going to leave the chat open for another hour, because the opportunity to bring so many people together to share their experiences and build on the ideas and momentum, we think that's a fantastic opportunity. And sadly, we're not all in one room together, but with leaving that facility open allows you to take more control of the chat and to be able to take your ideas forward. So we will have a soft landing at 6:30 and the chat will remain open even if the live stream has ended. Okay, I'm going to pass to our next speaker. That's Kateřina Konečná, an MEP from the Czech Republic. Let me ask you this question. Recommendation number 1 is that we need a new framework at EU level in order for the change to happen. Do you think this is a good idea? Would you support it? And what do you think the Parliament could do to make it happen? Kateřina, welcome.
So, thank you very much. And initially, let me thank the organizers for the honor of closing this conference, as well as Rare 2030 initiative. It was shown that the best way to help patients with rare diseases is through the investment for social justice. And it's a leftish idea. And for me, as a member of left-wing political party, it's the vision and value which I cherish and in which I believe. I am convinced that the recommendation from this study about what you spoke today came at the exactly right moment. It's not a secret that I consider COVID-19 as a door of opportunity which were opened and which helped us to find greater integration of individual health system in the EU, and greater cooperation in health policy between member states. Many of the recommendations presented in the study were familiar to me because I encouraged that at my work, and furthermore, it mirrors the ideas, attitudes, and experience of patients and the organization of the represents them. It's apparent that the way our healthcare system works today, it's no longer sustainable, and radical change is therefore needed. And the only answer how to help neglected group of patients and maintain our developed healthcare system in more Europe and more cooperation between member states. It's not only about the European Parliament and only about the European level. From this point of view, it's absolutely necessary that the Council draft the new recommendation of an action in the field of rare diseases, since the old ones are outdated. And I think it's necessary that we will push the Council on it. And yes, we still can make some important changes to enhance the current legislative framework at the European level. And thank you very much for your work to these days. Because I personally see a number of possibilities in the documents that we already have in the European Parliament, such as the Health Union files or the pharmaceutical strategy for Europe, where your recommendation could be integrated. And I do it, I believe you. After all, I'm a shadow reporter for literally every of these files, and I promise that I will try to incorporate your suggestion into them. We can also try together push the Commission by oral question to the new policy for rare diseases, and I'm open to do that. Yet the change but also come from the bottom, from the member states, which must agree on a change in a EU primary law towards deeper European integration in the fields of health. And there I see the crucial problem now, because they don't want, and I really say very open. This should not be a task only for me as a politician of the European Parliament, but also for national politicians who need to cope with it in the upcoming years. And I hope that Mr. Ministers, what we had now, and every politicians from member states will support us and approach their responsibility. Because I believe that the deeper cooperation only with and European-wide solution to the solutions of patients with rare diseases should be one of the topics of forthcoming Czech presidency of the Council. Because I think that now is a time to open your question on every side, but it's possible. And we as a Czech Republic will have a presidency, before us France, after us Sweden. And if it will be possible that we give it the rare diseases question to our presidency work, I think it will be great, because it's much work before us, as I said before, in a European level and the national level with the action plans and all these things. But in the other side, we need support from the council, and from the member states. And the presidency now can see us that it will be better, and that now it's a time to do it, and to do it together. And I hope that it happens, and we will see. But it's not only from my side as a European member; it needs to be so from side of the member states and the Commission. But I hope that we find a way how to do it, and thank you very much in the end, your colleagues from Eurodis, because you really help us with the EU for Health program, preparing with the amendments, with anything. And I was very happy that I was represent your position, and that in the EU for Health program, you can see many of your inputs, because it wasn't easy. But in the other side, it's possible. And I think this is the crucial message for the future, that it's possible.
Thank you very much. It's a very empowering and strong message. And I also like the fact that you started by saying that the issue of improving the situation for rare disease patients in Europe is a social justice issue, and that goes across the political spectrum. It's not a left issue or it's a right issue. It's an issue of basic fairness for society, and that we take your political commitment and your energy very much to heart. And thank you very much for being a champion for us in the European Parliament. We look forward to working with you again in the future. So thank you to Kateřina Konečná. We're now going to stay in that part of the world in the Czech Republic because, as we say, it's a forthcoming EU presidency. And I'd like to introduce the next speaker, who is Professor Milan Maček Jr. from the Czech National Coordination Centre for Rare Diseases. And here we're going to look at how we make this interesting triangle work. We heard from Kateřina that the European Parliament can only do so much. Its partner happens at national level. And that's an area where we often have reluctance to see an added value role for Europe. So what can the stakeholders in a national area do to help make space for that collaboration to happen? So let me invite Milan to come and answer a question. You've been around for a long time, and we have heard from earlier speakers how the path from the 2009 Council recommendations led to the progress that we've had today, and you were involved in helping to make these activities. What do you think is the best way forward to guarantee that we get a new policy framework? Because the number one recommendation that came out of RARE 2030 is we need a new policy framework. You were involved last time. What can we do to make it happen? Milan.
Well, thank you. Indeed, we need a new policy framework. That's absolutely clear. And I would be really pleased to provide a little bit of a personal touch on what we have done. And we all know that success is a combination of bottom-up and top-down initiatives and a little bit of luck. And I'm a medical geneticist, and I've been involved in diagnosing rare diseases since early 90s. And honestly, we know what it means, a diagnostic Odessa for patients and their families. That's absolutely clear. It's really a very big burden for them. And it's simple. As always, our work has to be genuine. We should inspire others as example. Easy said, but it's hard. It's not enough. And you need to also start educating your colleagues, many of whom even don't realize that they have patients with rare diseases in their clinical portfolio. So gradually you start building a community of likely-minded people, and most importantly, you need to change the culture within which we physicians traditionally operate. That's clear. That is to involve patients, and that's so enriching for us. They are true experts in their diseases, and only together we can build a momentum, and this is the key word, the momentum, and confidently approach together the policymakers. Only patients can demonstrate, unlike us, what is the real burden of rare diseases to them. And only this is the way that together, in a complementary and synergistic manner, to use the EU jargon, we can start the ball rolling. And as always, life brings surprises, right? And as always, serendipity comes into play. So I remember I've been contacted on December 27 in 2008 by the former Minister of Health on the ski slope, but would like to lead the rare disease so-called sector healthcare agenda of the upcoming EU presidency. But we were ready, and we were simply asked to carry the baton forward from the French EU Council presidency. And afterwards, again, it's quite straightforward. It has been hard work together with all the stakeholders, member states, commission, and I cannot say more the valuable contribution from Eurodis. And most importantly, now we don't need to start from scratch. We have the momentum. We just need a new framework. It's clear as this.
Thank you, Milan. How do you think that the Czech rare disease community could play a role in leveraging this and making this happen? You've talked about the need to connect top down and bottom up, but there's also a role that serendipity happens and windows of opportunity open and close. For a lot of people, COVID-19 has been a closing of windows of opportunity. Lots of treatments have been delayed, access to hospital and healthcare has been dropped because of the emergency. But Kateřina from the European Parliament thinks it's an opportunity. It's a window of opportunity because people are rethinking what we do and how do we do it. So from your point of view, how can the Czech rare disease community connect from the bottom to the top through this window of opportunity?
Well, as you said, we always tell our policymakers, look, there are marginalized populations, be the elderly in the COVID pandemic. And as Turkle nicely said, that there are these, I would say, not an epidemic, but these healthcare emergencies all the time, they go unnoticed. So it's not only the visible ones which make the media, it's among us, it's all the time here. And I have to say that I would say the most important part is that we have the European reference networks. That's a very solid basis, but they operate on goodwill and mainly enthusiastic basis. I know most of the people there, from various communities, the European society, but they have minimal financial support, and this is not sustainable. Another thing which hasn't been discussed here is the ongoing generational transition. Our younger colleagues have different approaches to work-life balance, and frankly, I understand them. So we really need a more sustainable ecosystem, or rather even a holistic policy framework. In the beginning, we heard the French Minister of Health, Kateřina, just voice the support on behalf of the EU Parliament, which is very important. Afterwards, we will hear the pre-recorded message of our Minister of Health. So, we keep the ball rolling. There is a clear momentum from the national side. So I would conclude, as I said in my previous response, action really speaks louder than 1,000 words. An absence of action, and this is what I'm really worried about, may revert us to the unfortunate pre-2009 situation. So I can only confidently say on behalf of the entire Czech rare disease community that we will be really pleased to work together with our political representation, with any other European stakeholder, whomever you think of. And importantly, we would really like to make things happen, because that's the only way how to change the things on the ground, irrespective of pandemic or any other political changes which might come in the future. Thank you.
Thank you very much, Milan. And we've seen that in the chat, we've had some suggestions that other ways that we could engage and create momentum would be to bring the professional societies, the learned research communities together with the patients to create more momentum for the bottom up. So that's a very powerful alliance between clinicians, researchers and patients that makes it very clear that there's consensus from the health sector towards the policymakers what needs to happen. Now going to invite the rest of the audience to share with us. We're going to ask you a question now, and we're going to ask you a poll. Do you think that we need new council recommendations? Milan has just talked about how this was all triggered by, in 2008, council recommendations. Do we need them? And their council recommendation would be used to promote national strategies that's coordinated by the EU and between member states. Is that what we need, or is there something else? Can we do a policy framework without having that political leadership from the council? We've spoken a little bit about the fact that a recommendation still doesn't guarantee you action. In 2008, member states were asked to come up with a national strategy, and at least 3 countries, still a decade later, didn't do it. But it does give us an angle in a mechanism. So let's see what the messages are from the audience. Do we need a new council recommendations? And I think it's fairly clear. 88% of you say, 90% say absolutely. 10% are undecided, perhaps because they think there might be a more effective way of doing it. Or put in the chat why you're in the undecided section. 12% are saying undecided, because it would be useful for us to understand if it's a question of yes, if it's implemented, or no, we need to focus our activities at another level. So thank you for that. Certainly over 80 to 85 to 90%, somewhere in that framework, are saying, yes, we need to do it. Okay, if we've got that message, the strong message, we need a new council recommendations. Now, let me ask you the question, how urgent do you think it is that we do something on this? We talked about the importance of having a policy framework, regardless as to whether it's council recommendations or not. How urgent is it that we have a coordinated policy framework for the development of rare diseases and the national plans across Europe? And we're going to ask you on a series of stars, where 5 stars is going to be very urgent, and 1 star is not so urgent, we could address other things. And as a reminder, the Rare 2030 project came up with 8 recommendations. So this is just one of the 8. What we're trying to do is understand from you is how urgent we should take it, as this is the one we should really be pushing for. And again, we're getting a very strong message that, you know, we've got the average score of 4.5 out of 5. So before we asked you, do we need new council recommendations? And between 80 or 90% of us were saying, yes, we need them. Now we're asking, how urgent is it that we get the policy framework in place that could then cascade down to national level to make sure we've got long-term national plans to deliver on that? So thank you very much. We're getting very clear messages that you as a community, based on everything you've heard and the breakouts where you discussed each of these recommendations, we need council recommendations, and it's urgent to get a new policy framework in place so that we can move on to delivery at national level. So having said that we need something to happen at European level, one of the future presidencies that's coming up is from the Czech Republic. And we have a recorded message now from the Minister of Health from the Czech Republic, giving us some insight into what their plans might be for their presidency. Here is Professor Jan Blatný.
Dear Mr. Chairman, dear colleagues, dear organizers of the RARE 2030 conference, dear rare disease patients, ladies and gentlemen, it's a truly great honor for me to address you on this very important occasion, and it is also my sincere pleasure to congratulate you on successfully concluding this important project, which addresses the future of rare diseases within the nascent decade. It has already been a year since European healthcare systems have been under tremendous strain. The ongoing pandemic challenges us to act quickly and protect our citizens at risk. We have been adopting truly unprecedented measures to tackle the pandemic. Solidarity and humanism has become more important than some segments of our economies. All of this is unprecedented. I am well aware of the fact that COVID-19 presents a great risk for rare disease patients. This risk could be either direct, for obvious reasons related to the underlying pathologies, and even more importantly, indirect, due to inaccessibility of regular care, due to overwhelmed hospitals, or even in some instances, due to the necessity to redirect our resources during the pandemics. Nevertheless, we have not neglected rare disease diagnosis and care, even under such difficult conditions. The Czech government has played an active role in preparing the first ever EU Council recommendations in the field of rare diseases during its presidency in 2009. Since then, we have been collaborating not only with a number of Czech experts, but also with overarching patients' associations at the national level, represented by the Rare Disease Czech, or at the European level by EURORDIS, all in close cooperation with our distinguished European colleagues. Since 2010, national plans or strategies for rare disease have been gradually established throughout Europe. National alliances were established or formalized, and despite several shortcomings identified by the European Court of Auditors, we have made substantial progress in terms of care for rare disease in Europe and beyond. In 2017, another major milestone has been reached. We have now functional European reference networks, which are gradually becoming the core infrastructure in the field. Prior to becoming a minister, I have been involved in one of them, and I clearly see their value. Currently, their extension is ongoing, and we hope that the European Commission will find sufficient funding for their coordination. At the national level, we are in the process of preparing a second decade-long national strategy which will capitalize on the outcomes of the RARE 2030 project. We will continue working with the Interdisciplinary Advisory Task Force at our ministry and the National Coordination Center for Rare Diseases at University Hospital Motto, in order to make general practitioners and pediatricians aware of rare diseases in order to improve the early diagnosis. My predecessor, who also had supported rare diseases, established a dedicated department at our ministry, the Patient Council, which advises us and reflects patients' interests and needs. This body is actively taking part in preparing new legislative proposals. It provides us with valuable information from the front lines, which we appreciate and do respect. In addition, we broadened the scope of rare conditions, which are subjected to nationwide newborn screening, and will run additional pilot projects in this regard to include additional disorders where there are pre-symptomatic therapeutic interventions. At the EU level, our government is looking forward to the outcomes of the Rare 2030 project. We look forward to use identified core Rare 2030 topics for the upcoming EU Council trio presidency, which is French, Czech and Swedish presidencies, to be held next year. Therefore, let me conclude with the underlying motto of solidarity. We learned that national governments cannot cope alone. We need EU-wide efforts, as it is now the case with the pandemic. Also, we should balance national and EU-wide approaches, and most importantly, we need to place rare disease strategies within the framework of a more comprehensive approach to vulnerable and marginalized populations. Importantly, such approach is at the core of traditional European values. I wish you all the best to the future, and we very much look forward to our future cooperation.
Thank you, Minister Blatný, for that message and the commitment again of the incoming Czech presidency to be pushing forward the agenda on rare diseases in the broader context of addressing groups that are underserved or marginalised in different ways. And this approach around social justice and inequalities is extremely helpful. We're getting lots of stuff coming through in the chat, and that's really helpful. So please keep adding things here where we've got people talking about the role of ERNs, how the European reference networks are useful because they're real leverage to shift the culture within a national health system. They're not perfect, and we've heard earlier they're under-resourced and they are not long-term sustainable, but they are a leverage mechanism, and that it could be used to stimulate the way that healthcare systems organise themselves to deliver services for rare diseases. So they could act as pilots as long as that gets rolled out. We're also having, we had a message from Romania to say that they're having a meeting in a few days to explore how they could take forward the recommendations, and they'll share the results of that afterwards. That's really helpful. Thank you. We've had a couple of people saying, well, you know, should we wait for a European framework? We shouldn't make that we shouldn't make our own work at national level dependent on that. But if we act independently, it means that we're then out of alignment when the EU message comes forward. So I think the point here is that we should push for a strong framework at European level so that we're aligned. There's at least each national plan is ambitious and doesn't stick with the minimum of what a government thinks they can get away with. So maybe this is where setting the sort of global ambitions at European level allows the national plans to fit in. So thank you for your suggestions. We're keeping an eye on the chat, and we always welcome your messages on what you want to do. We talked about the importance of political will, and the European Parliament has been a key partner for Eurodis over the years and will continue to play a role. And tomorrow you will have a chance to hear a full message from the President of the European Parliament, David Sassoli, but we thought we'd just give you a little introduction. We've extracted a short message. You'll hear at the Black Pearl event tomorrow at 5 his full message, but let's just hear just a taster of what he has to say.
Il RER 2030 Foresight Study raccomanda l'attuazione di un nuovo quadro politico per le malattie rare entro il 2023, che includa maggiori garanzie e raccomandazioni a livello di trattamenti, ricerche, diagnosi. Per queste ragioni il Parlamento europeo ha avviato il RER 2030 Foresight come progetto pilota, cofinanziato dalla Commissione europea e che prevede la partecipazione di molti di voi. Voi siete gli attori che hanno reso possibile tutto questo. La pandemia ci ha dimostrato quanto siamo fragili e quanto siano esposti i nostri sistemi sanitari, ancora di più per i gruppi di persone più vulnerabili. Ora più che mai dobbiamo essere sicuri che le azioni, le politiche siano adatte alle sfide di domani. Per raggiungere questo obiettivo abbiamo bisogno della vostra partecipazione, di una voce collettiva da ogni angolo dell'Europa. Il Parlamento europeo vi supporterà in questa sfida e si impegnerà a trasformarla in realtà.
Thank you to the President of the European Parliament, Mr. Sassoli, there for his message. And I think you noticed he talked about the importance of resilience and preparing to deal with future threats and pandemic. And the message that's been consistent through this afternoon has been how investing in a framework for rare diseases allows a progress, it creates resilience and capacity. It shares what's possible if you collaborate and connect the dots. Because it's impossible to address rare diseases unless you bring the different elements, whether it's data or different disciplines, together to see the bigger picture. And this is the skill. This is the benefit. This is the shared added value from the rare disease community into the broader health system. And here to give us some more insight about how Eurordis will take this forward and how they see the rare disease community as being the motor for change, I'm delighted to introduce Jan Lecam, the Chief Executive Officer for Eurordis Rare Diseases Europe. Jan.
Thank you very much, Tamsin. Thank you, and I feel privileged really to do these closing remarks. And first, as leader of this project, RER 2030, which has been really a fantastic adventure, I'd like to thank the members of the European Parliament who have initiated it and supported it all along. I'd like to thank the European Commission for funding this Foresight study and for their guidance. I also like to thank our excellent academic partners in this project and the not less excellent team working on it. Also to thank really our advisors and the experts, the 250 experts in the panel who have dedicated time and reflection to bring it to you today. So let's celebrate this fantastic production. It's a milestone which will inform our journey for the next decade. A foresight has three benefits: an immediate benefit to digest by pieces into the ongoing policies, so it can inform immediate action. The second is to prepare for the future, to prepare for the preferred scenario, but also to prepare for the one we hope will not happen, but at least we are prepared. And third, it's that there is a group of individuals like you today online who are prepared with the same vision, a shared vision, to implement it. So for sure, the 200 people who have been involved in the project, but maybe after this conference today, 700 or 1,000, we don't know exactly. These policy recommendations are forming a real roadmap. And this has immediate impact on the new EU programs within the multi-annual financial framework 2021-27, to mention some. Obviously, the Horizon Europe research program for the next years, the EU for Health program, which has a great importance for us, but also the European digital health space policy, which are top priority for the upcoming years. And not to forget the European structural funds, which are important at the member states level to fund activities. But second, immediately it can also inform, and it was mentioned today by the Commissioner or the representative of the European Commission, it can help to inform some of the ongoing revision of policy. It was also mentioned by several members of Parliament, such as the EU strategy on pharma in terms of unmet needs and access to medicines. It can inform the revision of the orphan drug regulation and the pediatric regulation, but also the incentives. And also there is some other policies which are under evaluation, like the directive on cross-border healthcare. And here too, it will be important to reuse some of the elements of this roadmap. Now, next year, we'll start a new cycle of the European Funds Network. We heard about ERNs all day long by each policymaker, how important they are. It's going to be a new cycle for 5 years. And here, we can reuse a lot of the elements from this roadmap, from the foresight, into this next policy. Now, I have to say that I regret that some years ago, we've been heard a lot. Thank you. We have 24 networks. But we also asked at that time for European Funds Network on rare infections, which didn't turn out. And also, we hope to have one in this new cycle for the pregnancies of women with rare diseases, which are all complex pregnancies, or women who are affected with a chronic disease or complex treatments. So I hope that will be heard too. But now, for Rare 2030, what it tells us clearly is that an EU policy on orphan drugs plus an EU policy on European Funds Network doesn't make a European policy on rare diseases. It's not sufficient. And I know it sounds strange because you could say, but they tick the box, there is already a lot. No, that's really not enough. Why it's not enough? Because the specific policies are essential, but they are means, they are instruments. They are talking about new products, additional drugs, about networking and activities. They are not talking about achievable results, impact, diagnosis, improving survival and quality of care, which is all about the scenario of this foresight. And for this, we need this holistic approach that goes from research and care, that grasp at the middle the data. You heard it all along. It has to be an integrated strategy between these three elements, and also integrated between the member states and the European level. Without this integration, it's all fragmented. It goes nowhere, even with good money and goodwill. It needs to be coordinated. This coordination, the European level has a responsibility, which is to create the umbrella, the policy framework, whatever it is, to make it happen. And this is essential, really, if the ambition by 2030, as agreed in the Sustainable Development Goals, as agreed in the universal health coverage at the United Nations, is to leave no one behind. If we're serious about it, if we're really serious to also address the needs of the 5,000 rare diseases, which affects less than 1 in a million in the population, the national level is not going to do it. We have to work on it together at the European level. So where are we now? And if we want this scenario of investment for social justice, we need to translate this recommendation into action. We could have a bigger problem to be nowhere, that we wouldn't know what to do, but that's not the case. We have a clear analysis, we have clear recommendations, and we know what to do. We have consensus in a community of multiple stakeholders. That's such a great asset. We have measurable results identified, and it's not so expensive to invest in. We cannot leave it just to luck or to chance. We will succeed because we want to succeed, because we have designed the right strategy to get there. We have now a unique opportunity ahead of us in the coming years. For Europe, it is to do something good, something right, to be proud of. For the 20 million of people who are suffering in EU today because they are affected by something which is rare, complex. But also there is the high expectations which we heard today in this fantastic film of the young citizens, the new generation calling for even more ambitious policy than what you just heard. Do we want to disappoint these young people? Do we want them to become so disappointed that they will really get nervous and at us and at policymakers to make it happen? No, let's act now to prepare this better future. Europe is an inspiration to the world. When we adopted in 2009 this strategy of national plans for Europe, which then have developed over the years, 6-7 years in all member states except 2 or 3, and not always at the best level, but as much as they could, it has inspired in turn Canada, Mexico, Argentina, Colombia, and progressively most of Latin and Central America, but also New Zealand and Australia. And believe it or not, now the Asia-Pacific Economic Cooperation, which brings together 21 countries around the Pacific, are working together on national strategies based on 19 pillars, completely inspired by our work in Europe. And this is the moment when we're supposed to stop doing it in Europe because we've done it yesterday. We're completely missing the point. We need to do it. We need to do it for ourselves. We need to do it to help the rest of the world to hold to it. Because part of that coordination is not only European, but has to be global. Rare diseases has been a spearhead in healthcare and health strategy so far. So I'd like to speak a bit about COVID. I think the President of the European Parliament, MEPs, ministers have all mentioned COVID, right? Let me mention it in a different way. First, the Health Commissioner mentioned it, the European Funds Network. They have been extremely helpful immediately from the beginning of the pandemic. It would have been even more helpful if we had this European Funds Network on rare infections, but we'll get it tomorrow, I'm sure. So that was useful. Why? Because clinicians could immediately communicate, because there were a platform where to share data from patients to discuss the complex cases. Now, let me take you to the immediate next challenge. Some of the patients with COVID, as you know, may have symptoms long after their infection. 2, 3, 4, 5 months later. They are called the long COVID. Today, they are into a maze. They don't know where to go. And mostly where they go, it's in rare disease centers for neuromuscular diseases or for rare lung diseases. So let's tackle that immediately. Let's organize at the European level to address the needs of this long COVID. There are going to be only few of them. It's not going to be a prevalent disease. It's a rare disease. It's an immediate challenge. Let's adapt. Let's do it right now. Another example is the vaccine. The vaccine, the RNA vaccine from Pfizer and from Moderna, are both based on technologies which are coming from research performed in Europe on one rare diseases, which is the amyloidosis transthyresis. I'm not saying it right every time, I know, but also from research on some rare cancers. Because the science was there, it was possible to accelerate with significant money to get to the vaccine. So I would argue that the return on investment for Europe has already been quite high on investing in research on rare diseases. So continue to do that. Invest in healthcare for rare disease, invest in research for rare diseases. There is a win for everyone. And also, last but not least, with the COVID, suddenly what was not possible yesterday becomes possible. Member states come together under the European Commission to negotiate with laboratories for the vaccines and to do joint purchasing. We are really hoping that this tomorrow will happen for rare disease therapies. Maybe not for all therapies, but at least for the ones which are the most complex, like gene therapy and cell therapies, and for the rarest diseases, because that's the only way to go. If not, we will only increase inequalities and innovation will not get to the patients. So what we have heard today is that the Health Commissioner is supportive. The Court of Auditors is calling for a revision and adjustment of the policy. The members of the European Parliament are clearly pushing for an improved framework for the next years. And even the President of the European Parliament has sent a very clear message. Rare disease is at the forefront of collaboration between member states and of integration of health strategy between member states. That's a good thing to have when there is health challenges. We have a pandemic today, but tomorrow we may have other challenges which are relevant to health, where we need to collaborate much more. So we need to encourage it even more. And this is what France has done by saying that rare disease will be a priority in their EU presidency in the first semester next year. But also the Minister of Health of Czech Republic said it will be a priority for his country during the second semester, and that is calling for the trio of the presidency with France and Sweden to make it a trio priority. So with MEPs and the members of state, I hope that now the Commission will be on board to prepare a new Council recommendation on rare diseases, to immediately prepare a draft in order to create all the glue in addition to the silos for a comprehensive approach, integrated approach, so that not only we have a protective hand on people with rare diseases in Europe, on what has been done in the past and continue that kind of national plans and strategies, but also has a helping hand for the rest of the population and focused on public health objective, measurable objective to be proud of 10 years from now. Thank you.
Thank you very much, Jan. I'd like to congratulate you for that, because I think that was a really very clear and very powerful message, and I hope people heard it. We're now coming towards the end of our time together today, and I hope you would agree with me that it's been significant, it's been full of information, rich in content, and I'm sure you'll need some time to digest and think about it. But we ended on a very strong, rousing message to say that this is possible, that this has already delivered huge benefits for Europe. There is a way forward, that the ERNs and the sharing of data is a beacon, it's a pilot for the way that we could do things in a connected, interdisciplinary way, and that as Europe looks at what it can do to reconfigure its approach to health, whether the actual transformation happens at national level or is led at European level, the one thing we know is working together, whether it's sharing data or joint purchasing or joint surveillance or epidemiology, sharing the knowledge is the way forward, and it's an answer to building the strength and the resilience in our health systems to cope with whatever's coming. Some of it we already know, but we also know that there are more uncertainties coming in the future. And what we need is the capacity to deal with the unknown. And what better part of a health system than rare diseases, which spends its whole life tackling the unknown, moving in unknown territories, finding a signal in the noise, putting together different pieces of a puzzle to see what picture you get. And only then do you know what you're dealing with and can you start a way to tackle it. So I'd like to say a warm thank you to all our speakers and all of our participants. At one point we had 670 people online, which is, we would have filled the European Parliament building and further. So we can see that there's an interest and an engagement. As we close the official live stream part, as I said earlier, we're going to leave the chat open for another hour. And we'd really love to hear from you. What did you find interesting and inspiring? What are your key takeaways? What actions would you like to take? Is there anyone that you'd like to work with? Are you calling for assistance and support? Do you want to be in coalition with anyone? How can we use the energy of today to take it forward for a momentum for change? And so what I recommend you do is, as we, starting from now, as we close the live stream, put your name and your country in the chat so people can see who else is there and we can see what the opportunities are going forward. You can't see it, but behind me there is a room full of technicians and full of screens. It was a huge technical effort to make this conference happen. It was extremely smooth. So on your behalf, the audience, I'd like to say a thank you to the unseen people around who made this event possible. It's been a fantastic collaborative effort. Thank you all for your time and spending your afternoon with us. I hope you will agree it's been really valuable and there's a lot to look forward to for this community. Thank you very much. We're going to end our live stream. Look forward to seeing you tomorrow at 5 p.m. for the Eurodis Black Pearl Awards 2021. Tuxedo may be optional. I don't know yet. You'll hear more tomorrow. You'll have to tune in and see where we go from now. Thank you from the Brussels studio.
We don't need no destination.